All about collaboration, co-creation, and learning. So, ladies and gentlemen, I want you to get all your learning juices on. Get ready to be excited. It is going to be an amazing 3 days. But before I get carried away with having a good time, by the way, I'd like us to please welcome somebody that's very special to all of us so that we can have a brief security briefing, just so that you can know what is beautiful about Nairobi, where you definitely need to visit in Nairobi, but most importantly, if you visit whatever you want to visit in Nairobi, how do you visit that particular place in Nairobi? Please, ladies and gentlemen, I'd like us to please put our hands together as we welcome Dr. Maggie Walker to give us a brief. Please, a round of applause for her. She comes on up, ladies and gentlemen, yeah?
Thank you. I'm officially his co-MC. So, first of all, just wow. It's so amazing to see you all. I will not get into speeches. I will stick to my brief. My brief is security briefing, but very happy to see you all. So just a quick briefing and housekeeping. In terms of the emergency exit, the emergency exit is just outside on your right. And I know I have the hotel who will help me, the hotel security team who will help me show you that. We have the washrooms which are on my left, just around the corner. I will hand over to my friend Frederick first, and Ibrahim, sorry, and then I will give you more about Nairobi.
Thank you. Good morning, everyone. Yes, my name is Ibrahim from the hotel security. Just to take like 2 minutes to brief you more about safety in the hotel. One is that we are all on 16th floor, and 16th floor, and we have no plan any mock drill today. So just in case you hear of any fire alarm going on, please remain seated. The second will be communicated to you all, just in case there is need for us all to evacuate. And in case we need to evacuate, we have 3 emergency exits behind you all, wide enough to accommodate all of us. And let us all walk in a single lane, which will direct in a single lane. Outside, we have an emergency exit to the far end and another one just behind this door. Let us use all those emergency exits that will all lead you to the emergency assembly point on the ground floor. Secondly is that for those who have the cars, the parking is complimentary. Our tickets will be validated on the 8th floor. Nothing much. We have fire marshals on site. We have first aiders just in case there is need. And also we have a doctor on call in case there is a need for us. Thank you and have a blessed day.
Thanks, Ibrahim. And so to add on that, we also wanted to highlight that there is translation for the French speakers. So you'll see the headsets on the chair. Channel 1 is English and channel 2 is French. And please make sure that at any one point after you leave the headsets and the gadgets on the chair. Then finally, just to say, welcome to Nairobi. We always say that in Nairobi, Nairobi is a very beautiful place, but we also urge you to also just take caution whenever you're outside. Keep your phones close to yourself. Yes, and in case of anything, just please feel free to reach out to us. If whether there's an emergency, like he said, we have a standing ambulance downstairs in case of anything. But then also if you lose anything, just please come straight to us and we'll be able to direct you to the right place. Other than that, also to remind you to keep your phones on silent so we can be able to engage and listen to each other. Yeah, I think that's it. Over to you, Lotan.
Please celebrate Dr. Maggie. I think she deserves a better round of applause. Please put your hands together for Dr. Maggie for that. Now, ladies and gentlemen, I think the only thing she forgot to say is have a good time. So get ready to have an amazing time over the next 3 or so days. But at this juncture, I'd like us to do something that's quite very special to all of us. I'd like us to please kindly be on our feet. I'm requesting us to just stand up for... Now, ladies and gentlemen, it has been such an emotional year for us right here at Amref. And at this particular juncture, I'd like to invite you to specially join us in a minute of silence to honor Amref's fallen heroes, colleagues and partners who dedicated their lives to advancing health in Africa. Please. Thank you very much, ladies and gentlemen. You may kindly take your seats. Asante. Please, yes, a round of applause for them as well. Thank you. Now, ladies and gentlemen, I am so excited. And officially, I want to welcome all of you to AfyaFest 2025. It is great to see you all from all around the beautiful continent and, of course, beyond. But most importantly, ladies and gentlemen, over the next 3 days, this amazing inaugural gathering is your particular launchpad to turn big ideas into impact, to co-create, accelerate bold, scalable, and innovations that, one, improve healthcare access for vulnerable populations, create dignified jobs, especially for the women and the youth, and integrate solutions into national and regional health systems, and celebrate African ingenuity and cultural relevance. Now, ladies and gentlemen, for this maiden amazing edition of AfyaFest, we have so many of you that traveled from so far to be here. So, ladies and gentlemen, at this particular juncture, when I call your nationality, I want you to stand up. If you have some sort of a flag, if you are the flag that you're going to be screaming with, feel free to do that as well. And in no particular order at this particular moment, I want us to please put our hands together as we specially celebrate all our amazing delegates all the way from Egypt, ladies and gentlemen. Please put your hands together for Egypt. Is there anybody from Egypt in the auditorium? Probably they're trying to sort out their registration. All the way from Botswana. Please stand up, Botswana. There we go. Make some noise for Botswana. Ladies and gentlemen, all the way from Eswatini. I think they're also outside sorting out their registration. Ladies and gentlemen, make some noise for Zambia. Wave, Zambia. There we go. Look how amazing Zambia. Ladies and gentlemen, they say they have the best jollof in the continent. Please put your hands together for Nigeria. Ladies and gentlemen, all the way down south, they've given us nothing but amazing music. Please, a round of applause for South Africa. Now, I'm going to give context to this next one. They are our neighbors, but it's a proper sibling rivalry. The Kenyans understand, and they also understand. Please, ladies and gentlemen, make some noise for Tanzania. Beautiful. Allow me to exit the continent for just a minute. Please, I want us to celebrate. I think they probably traveled from their fathers all the way from Canada, ladies and gentlemen. Make some noise for everybody all the way from Canada. There we go. Look at them. Hours and hours of flying time. Now, they claim and they say that is where humanity started. Ladies and gentlemen, please, let's put our hands together for Ethiopia. Beautiful. Thank you very much, Ethiopia. Ladies and gentlemen, let's move on to the land of 1,000 hills. Make some noise for Rwanda. Ladies and gentlemen, allow me to go all the way to the west of Africa as we celebrate the country with the lions of Teranga. That is what they boast of. Please make some noise for Senegal. Now, I told you about the guys that claim they have the best jollof. Now, this next guys really have the best jollof, ladies and gentlemen. Make some noise as we celebrate Ghana. And finally, ladies and gentlemen, I want us to celebrate our neighbors here. Please put your hands together for the Pearl of Africa, Uganda. Tell your neighbor, and now, We want to celebrate the host nation this year. Please, I'd like us all to stand up as we celebrate Kenya! Beautiful. Now, I request us to remain upstanding at this particular juncture, ladies and gentlemen. We'll take the national anthem of the Republic of Kenya, and then it will be followed by the East African anthem. Ladies and gentlemen, the national anthems. Thank you very much, ladies and gentlemen. You may kindly take your seats. Are you happy to be here? No, I can't hear you guys. Are you excited to be here? Now, ladies and gentlemen, over the next 3 days, get ready for inspiring plenary and panel discussions, thematic track and studio times, master classes and technical workshops, solution showcases and pitches, which we're all looking forward to, by the way, and of course, networking and collaboration spaces, and celebration and awards. So ladies and gentlemen, it is gonna be a power-packed next 3 days. And I'd like to welcome somebody very special that's gonna set the mood, set the tone for this amazing event. Now, ladies and gentlemen, this particular first speaker is a futures researcher specializing in digital transformation, global health, and international development. Now, ladies and gentlemen, one fun fact about her, probably I learned it yesterday, she loves dancing. So please, ladies and gentlemen, I'd like us to please put our hands together as she dances all the way to the front, a rounding of ovation as we welcome Miss Caroline Mbindio up on stage. Makofi kwake tafadhali, a round of applause. Are you dancing? No, that's the song. Please put your hands together for Caroline.
Thank you very much, Lotan. Welcome everyone. My name is Caroline Bindio, as introduced, and I don't like dancing at all, It is my distinct pleasure this morning to welcome you all to AfyaFest 2025. We are delighted to host you. Thank you all for coming and joining us for these 3 days. The Nigerian poet and novelist Ben Okri wrote, "Beware the stories you read or tell. At night, beneath the waters of consciousness, they are altering your world." These words are a powerful reminder that narratives shape reality. What do we hear in the news about Africa? We often, very often, hear about Africa's high disease burden. Some people talk about 50% digital. Others talk about 50% analog. We hear about climate change, the impact it's having on climate refugees, disease outbreaks, vector-borne illnesses, food insecurity, and so on. The news speaks of political and social unrest, of corruption and poor governance. We read about the debt crisis, which means that 57% of the population of Africa, 57%, that is almost 6 in 10 people in Africa, live in a country where they pay more in debt than they do for health or for education. Every day we read, and some of us live the story of youth unemployment. These are true stories, and they can leave us with a sense of hopelessness. But they are not the full story. There are many other stories that we do not hear enough about. One of these stories is that by 2050, 1 in every 3 young people in Africa will be living in Africa. 1 in every 3 young people globally will be living here in this continent. In contrast, countries like Italy, Spain, China, Japan, South Korea are already not able to replace their population. They rely on immigration for demographic, or their demographics would decline. We hear of the debt crisis, but we don't hear about the fact that Africa has 10 of the 20 fastest growing economies. Regional frameworks like the Africa Free Trade Agreement are already unlocking value across borders. One of the most profound and defining stories is that Africa is home to the fastest growing digitally native population in the world. This is not just a demographic statistic. It represents a generational force which has fluency in technology, creativity, and agency to drive innovation, especially innovation in health entrepreneurship. At AfyaFest, over the next 3 days, we gather to listen to stories of health and innovation, stories of how young people, young Africans, are shaping the future of health on the continent and demonstrating the power of African ingenuity. We start this morning with stories that will highlight the role of young people as drivers of health innovation, that showcase the role of higher education in building the next generation of health innovators, that show how investments in healthcare and innovations can transform health outcomes and livelihoods across the continent, that highlight how collective action, like the Africa Health Collaborative, accelerates innovation and scale, and that spotlight the importance of enabling ecosystems for youth-led innovation. We have an amazing group of speakers who will take us through these stories. I would like to welcome them all on the stage. Please help me to welcome Dr. Christine Mutoni, Professor Joachim Osur, Dr. Edwina Apau, Emanuela Alimlim, thank you. We will start with Christina. Christina is from the Youth for Afya Coalition. She's a medical doctor who is passionate about being part of the solution in health. One fun fact about Christina is that she is obsessed with the color pink, that she had to stop herself from wearing pink to today's session. So welcome, Christina. She will talk to us about the role of young people as drivers of health innovation. Welcome.
Thank you so much, Caroline. Yes, I really do love pink. I feel like I have to literally stop myself sometimes from buying something pink or wearing something pink. Yes, but thank you so much, Caroline. Good morning. As you've heard, my name is Dr. Christine Mutoni. So I come here as a representative of the Youth for Afya Coalition, and I'll tell you a bit more about that. But before I do that, I want to pose a question to everybody. So what is a youth? What is a young person? And what do the youth want? Like, what do we want? Why are we here talking, making noise? And I'll share the first time I identified myself as a youth. Not that I wasn't young, I knew I was young, but I'd not identified myself as a youth until I attended the Kenya Healthcare Student Summit. That was in 2019. So that's about 6 years ago, yes. The reason why I say that's the first time I identified myself as a youth, because that's the first time I found myself with fellow young people who were very dedicated to their careers, very dedicated to their studies, very dedicated to the path that they had chosen in life. But more than that, they were dedicated to actually creating change, to actually solving the problem. Now, fast forward 6 years later, I'm a qualified medical doctor. I have the privilege of helping people who are in pain, who are affected by disease. But then I realize there's so much that needs to be done beyond the clinic, beyond prescribing the medication, beyond making that diagnosis. I realize that my patients may not take their medications, not because they don't want to, not because they don't understand, but because there are factors beyond the disease itself, beyond the hospital itself, that are driving the decisions that they make. Therefore, I realized then the solution to some of these problems must be outside. So then I went back, I wore my youth hat again, you know. So I found myself as the convener for the Young Doctors Network in Kenya. And as the convener for the Young Doctors Network, I also found myself in the Youth for Afya Coalition. So it's a coalition for, just like the word, Youth for Afya. So young people who are passionate about healthcare, passionate about fixing the policies, passionate about being part of the solution. So it's a coalition of different organizations, all youth-led. Some are students, some are qualified, but all of us have the very same goal. We are in different careers as well. Some are doctors, some are pharmacists, but we all identify with the same issue. We need to actually make a change in healthcare. So then I go back to the question I started with. Who is a youth? So a youth is a person, in my opinion, a person who sees the problem as what it is, a problem. And not only that, tries to find a way to fix that problem, because we do not have to stay with the problems that we find in the places that we work, in the places that we live, in our community, and more so in our country. So I'll say in our context in Africa, the youth are the people who are going to actually take the continent forward, okay? So youth are policy makers, youth are change makers, and youth are the change that they want to see. So talk to your neighbor and tell them, you're the change we want to see. So if you leave this conference with nothing other than that, I'll be happy. Thank you so much. Have a good day.
What an awesome introduction to the session, all about the power of identity. How do you identify yourself? And looking at young people as change makers, problem solvers, activists, advocates, collaborators, people who love their country and want to see their countries flourish. Thank you, Christine. Our next speaker is Professor Joachim Osur. He's the Vice Chancellor at the Amref International University. He is a renowned reproductive health expert with wide experience in reproductive health policy, services, and research. In Kenya, Professor Joachim wins the award for the person who talks the most about sex. He is a renowned sexologist. So if you have any questions about sex, you know who to speak to. Thank me later. This morning, Joachim will speak to us about the role of higher education in building the next generation of health innovators. Prof, welcome.
Thank you, Caroline, and good morning, everyone. First, I want to welcome you on behalf of Amref International University, and the Africa Health Collaborative. I sit in the Executive Steering Committee of the Collaborative, I'm not sure whether Dr. Kere has arrived. Not yet. Oh, you're representing. Okay. Yeah, so we sit there with Dr. Kere from Moi University. That is the Kenyan team. And we have colleagues from all the 9 partner organizations that form the collaborative. I know you are all represented here. We welcome you, including our senior sister from MasterCard. I can't, yeah. We are together here, you. So please welcome. We appreciate the chance to host this. Let me go back to what I've been requested to talk about, the role of higher education in creating innovation and related, benefits of that. A few years ago, a young doctor, just like my colleague here who has spoken, in one of our cities, Mombasa, committed suicide. And he committed suicide because after looking for work as a qualified doctor, he was not getting a job immediately. He got frustrated, he was broke. When you're a doctor, I'm a doctor myself, so when you're a doctor and you're in the community, they expect you to be driving a car and having a good life. But this guy was broke, couldn't get food to eat, did not have a job. So after struggling for some time, he wrote a suicide note and killed himself. And it was in the newspapers all over. And we are having a lot of new graduates going through that kind of stress. There are a number of them who are in depression as we speak. Which begs to the question, if these people did not go to university, would they find themselves in that depression and, wanting to kill themselves? Has education empowered or disempowered them? If they left school in high school and started doing some business, would they be better off? And that is the question that we need to answer in higher education. What is the university or college doing to the individual? Is it killing innovation? Is it limiting their chances of thinking outside the box? Or is it actually adding value to their lives? Now, in my stand at the university as a professor and interacting with students and lecturers and the whole education ecosystem, there are things I've learned. We have a problem in the education sector, which we need to deal with. And this is an African problem. I see it in Kenya, and I see it in many parts of Africa. I don't know whether it happens in Europe as well, and the US and other places. But the university trains you on one thing. So when you're admitted to be a doctor, they train you on that. And then they release you with high expectations. Actually, it is said that graduates have higher expectations and higher value of themselves than they are. They forget that they are existing in a world which is different. And so universities and higher institutions of education should change the way they do things. They should be able to empower an individual so that if I'm trained as a doctor, I find myself in an engineering company, I should be agile enough to add value to that company. Because, as you know, the jobs of tomorrow are not known today. If you're training as a nurse, you're training as an engineer, a social scientist, by the time you come out after your 3-4 years of college, that job will have totally changed. So are universities training graduates to fit in the jobs of the past or jobs of the future? That is the question we must ask ourselves. And in our university, what we do is to try and break that jinx. We try to, if you're training as a physiotherapist, we try to make you fit in any sector. So we do things called micro-credentials for these people to know, if you're a nurse, what actually happens in the commercial sector, what actually happens in agriculture. We encourage people to learn things beyond their sector. So that if you find yourself without a job as a doctor, you should know that there is value you can add elsewhere. And there are three key things that if we build in an individual, they will be able to do this. One is the ability to connect with people. Universities have not made us social enough to connect with communities and to know what people go through on a day-to-day basis. Universities were called towers of knowledge. They made you a socialite, something away from the community. Universities need to make us connect more. And in our university, we try to take our students to the community. We tell them to connect with the villages, to connect with households, to talk to people, and not just there, but also globally, so that they have a global thinking, but they are also connected locally. If you are able to connect locally, you can detect the problems people have. That is the beginning of innovation, detecting the problems people have. Bill Gates didn't need to go to school to detect a problem that people had. Maybe if he got a degree, he would not be the Bill Gates we know today. Yeah? I've been wondering why, as a professor, I'm not rich. Possibly it is what Bill Gates ran away from. Yeah? Being made to think in a certain direction and disconnecting yourself from problems that people face every day. Not being able to connect at a personal level, to empathize and understand really what people go through. That is something universities must do. Secondly, being able then to innovate a solution to those problems you've recognized. So if people are suffering, you've connected with them, you understand them, you empathize, you've realized a problem, can you come up with a solution? Money follows, jobs follow if you have a solution. And the third thing, because of time, is how to make that solution then scalable and profitable. Turning that solution into money, into something that can also create employment for other people. So now that you are in Kenya, you know about M-Pesa, the mobile money. I'm told it started with a student, I think he was a university student, who innovated that. It's a long story. Then, of course, he sold it to Safaricom. But look at what it has done. It has transformed the financial sector, and it has gone beyond Kenya and other places. I'm now able to do my banking here. I can pay my bills as I do the panel. Now that is innovation. But are we able to innovate such? Can students from universities and lecturers and the academic community be able to do that? I think that's the problem. So in our ecosystem, in our university, we are trying to do that. And we can talk more about it when time allows, but because I was given only 7 minutes, allow me to be disciplined so that I sit down. Thank you very much.
Thank you, Professor Osur. I think moving away from identity, but really maybe a different type of identity, and expectations. How do we meet the expectations of young people? And what do universities need to reimagine themselves and their roles as educators? I think the challenge really is to our faculty, our universities, the people who set our curricula. How can we support students and young people to thrive in a complex and rapidly evolving world? I think the challenge is yours. Joachim, we'll be looking at you to see what the AMU University is doing. Next, we have remarks from Dr. Givinji Gitahi, who is the Amref Group Chief Executive Officer. He was to be here with us, but he sends his apologies. But current circumstances do not allow him to attend this session, but we will show his remarks. Video, please. Thank you.
Colleagues of the Africa Collaborative and all of you present, I would have wished to join you at AfyaFest, but because I can't join you in person, I'm happy to share my views and my inspiration on this video. And I think the first place to start is to say health has remained the foundation for economic growth and prosperity in Africa and everywhere across the world. In our continent of Africa, we've been significantly challenged, and we continue to be so, in that less than 50% of our populations, going by the WHO Universal Health Coverage Monitoring Report, have access to the health services they need where they need them. And when you talk about financial protection, it's even worse. And we know that the continent of Africa depends on healthy children to learn and depends on healthy adults to earn for us to have economic growth and achieve the desires of the Africa we want 2063. So health, therefore, is a key investment that we must make, not only as government, but as private sector and other sectors as well of society. But we find that within the continent of Africa, we are challenged by access to resources. To just give an example, the entire continent of Africa, with about 1.5 billion people, has a GDP of about $2.8 trillion. Look at Germany, with probably 80 million people, with $4 trillion. I just came out of Japan for TICAD, 122 million people, with also about $4 trillion. So it is actually a challenge to divide the limited resources with the large population, tax, and then provide health services. So if you do the math of the economics of Africa and the demographics, and you apply basic mathematics to the GDP on taxation, which is going to be probably just tax about 20% of it. Africa taxes at about 15%. Then you take that tax and you say, okay, you want to apply that as the budget for the year based on the tax you collect. And you say you want to even do a Abuja declaration of 15%. In the continent of Africa, based on the numbers I've given you of the mix between GDP and population, you'll be lucky to end up with a per capita allocation to health of more than $50 per person. Now, in Japan, in Germany, in other high-income countries, that number is close to $4,000, give or take. So you're trying to say that you should actually achieve universal health coverage at $40 per person per year of government money, whereas in other countries they have access to $4,000. So it positions that there is a big challenge to provide health services to people of Africa with such low resources, even if you allocate, as we have said on Abuja Declaration. The question then becomes, how do you do this? It is important for us then to shift our mindsets to say that we must not follow the biomedical model of treatment, because we can't afford it. If you are trying to treat everyone with sick, and especially with rising non-communicable diseases, unfinished business of infectious diseases, the challenges of maternal and mortality, it will be very difficult to say you're going to just focus on treatment. Which then brings me to this concept of health production, that we need to reorient our health system to a health production model. And that speaks to primary health care, where primary health care is the pillars of primary care, where primary care is services available to all, especially women and children, at the first point of contact, where they live, work, and play. The second pillar of primary health care is to ensure that the community that is around that primary care is empowered and well educated and aware of the services they need, and also how to deliver those services, but also how to keep themselves out of disease. And the final pillar is multi-sectoral action, meaning that we are looking at water, sanitation, we are looking at transport security, and what role they play in maternal and child health, in reduction of non-communicable diseases. So we are looking at primary health care as this health productive tool that then delivers better health for people, and therefore we do not have to spend our meager $40 on treatment because we can't afford it. As I've said before, Africa cannot afford health care, but Africa can afford to produce health. So in this then, we say we have then a demand that we cannot do primary health care the way we've done it in the past, which then speaks about redesign, talks about innovation, talks about a new way of working, and also how to leverage on existing new tools like digital technology and other technologies and artificial intelligence, which then says that there is actually a demand for innovation for us to create a primary healthcare model that gives Africa health for prosperity. So AfyaFest for me then is a platform of linking this demand and supply, and that supply is going to come from yourself, young people working with universities as partners of this health collaborative, young young people who are delivering innovation through technology that can then solve this conundrum of trying to ensure that we don't focus on healthcare, we produce health. That means we'll need tools in people's hands. We will need data that is closer to the people. We will need data that's responsive, data that also allows us to actually make early diagnosis, because a stitch in time saves 9. But how do you do that? You do that through giving tools that ensures you that you actually have a stitch in time to save 9, because our $40 cannot afford 9, but our $40 can afford a stitch in time. So I'm looking forward to the outcome of this collaboration, this conversation at AfyaFest, in delivering innovation that enables us to have primary healthcare as the platform for health production that is going to be the basis for a prosperous continent. I wish you the best, and thank you.
And I think Githinji is the example. He's a good example of what Joachim is talking about. He trained as a medical doctor. He worked as marketing director. He is a poet. He started his career, his professional career as an intern at Amref, and went all over the world before he came back to Amref. So this is the kind of thinking that we want to see. How do we impart this thinking to young people? And he also gave, I think, a really good challenge. Africa is often seen as a consumer continent, that we are consuming, but we are not producing. So what is it that Africa needs to produce? In the health sector, he talked about producing health. What does that look like? That is a completely different model of healthcare that speaks to our context and speaks to a deep understanding of what Joachim was saying. What do communities need? What do young people need, as Christine asked? So this is part of the context that we will be creating over these 3 days. Our next speaker is Dr. Edwina. Dr. Edwina is a program manager for the Africa Health Collaborative Office of the Vice President International at the University of Toronto. Edwina loves running. I told her she's in the right country. So if any of you in the house are runners and need some of her wisdom, you need to invite her for a run. Edwina will share the vision. And scale. Welcome, Edwina.
Thank you very much. It's such a pleasure to be here. And if you are an expert runner, please don't come looking for me. I just run for fun. It's my pleasure this morning to actually share a little bit about the Africa Health Collaborative. And I've already had people asking me, who is and what is the Africa Health Collaborative? The collaborative came together, we started about 4 years ago. Now we're in our 4th year, moving towards our 5th year. And I think the previous speakers have really given us the foundation for who the collaborative are. It's a collaboration of brilliant universities, higher education universities, of which Amref is one, across the continent of Africa. And then the University of Toronto, which is the only university that exists outside of the continent that is part of the collaborative. And so when you bring these brilliant universities together with the amazing young people that we are talking about today, something amazing happens. And that's one of the reasons why we're here today. The partners consist of University of Toronto in Canada, and then in West Africa, we have Ashesi University, and some of our students may be from there. We have Kwame Nkrumah University of Science and Technology. And as we move to East Africa, we have Addis Ababa University represented here, and in Ethiopia. In Kenya here, we have Amref International University, of course, and Moi University. And then in Rwanda, we have the African Mathematical Institute of Mathematical Science, AIMS, and Africa Leadership University, ALU. And finally, in Southern Africa, we have the University of Cape Town. So you can see that this is really a list of highly esteemed universities who are coming together to support the work of transforming healthcare across the continent of Africa. And at the forefront of that is our young people. When you consider the number of young people on this continent and the audacity and the brilliance that they bring to the table to innovate and support the work of healthcare, I think that we can all say that Africa has a bright future ahead. And for us as a secretariat, I represent the secretariat, we are excited about the young people that we get the opportunity to meet. So who is the secretariat then? We are a group of people that have the privilege to work across the partnership with their partners, bringing them together to collaborate and working with the ideas that are coming on the table. Our lead is Ms. Gwen Barrows, who is situated at the University of Toronto, and Dr. Panina Lam, also at the University of Toronto. We have part of our team situated at the University of Toronto and part also across the continent in West, East, and South. And the idea of splitting us up is that as connectors for the collaborative, we can be close to the partners. So you will find us literally everywhere. Hence, my colleague and I are representing here at partner engagements. You will find us in the midst of supporting governance. We sit at all the tables, the major tables across the Health Collaborative. You will find us there as the Secretariat team. You will find us visiting each partner and working one-on-one with the partners, supporting their ideas, as even supporting program design, onboarding, and many other responsibilities, administration, and that's what we do. So we are really the connecting partner within the Africa Health Collaborative, and that places us in a very unique position. We get to see what happens at each of the partners, and therefore we're able to bring partners together to create in a way that really leverages the synergies across the board. So we are truly privileged, and I have to say that we want to thank Amref for inviting us to this AfyaFest 2025. I really want to thank Amref on behalf of the Secretariat for actually stepping up and doing this. The remarkable team work that they have put together to bring this together is actually very inspirational. Back in June, I think, when we reached out as a Secretariat to Dr. Irungu and said, can Amref do this? We had 3 months to prepare. But the team came together, thank you, Professor Osuo, and what we have today is the amazing product from that remarkable leadership. So on behalf of the Secretariat, I just want to say a huge thank you for stepping up and doing that. And before I sit down, I just want to also just give a word to our young people, our young leaders who are in the room. This AfyaFest event has been put together with you in mind. We recognize that you are the present and you are the future of this great continent. We admire your mind and the abilities that you have to bring to the table to help us solve the challenge of healthcare across the continent. And we know you are up to the task. we believe that you are absolutely up to the task. And the higher education institutions are here to support you. We have brought together mentors, investors, and all kinds of individuals and opportunities here to support you in your entrepreneurial journey. And so we say to you, make the most of this opportunity that you have. We are looking forward to seeing what you will create for this great continent. Thank you very much.
Thank you for those remarks. When we speak about the power of the collaborative, the universities which are part of the Africa Health Collaborative, we must also speak of the power of collaboration and what each of those universities bring to the collaboration, but what this meeting brings to the collaboration. When we talk about the ventures who are present in this room, they are from more than the collaborative universities. We have ventures from 14 different countries. So this is the power of how do we convene, how do we bring young people to talk about what they're doing, what problems they're solving for, what help do they need, how can they help each other, and how can others help them. This is what the power of collaboration brings. This morning, our panel will end with Ms. Emanuela Alimlim. Emanuela is the lead for the Health Collaborative Special Programs at the MasterCard Foundation. Those of you who have had the pleasure of meeting Emanuela even once know that she is a passionate change maker who believes in the potential of young people from across Africa. One thing that I'm sure many of you do not know about Emanuela is that she lived in a convent in Kenya for 6 months. So when you see her on the corridors, ask her what was she doing there. This morning, Emanuela will speak on the importance of enabling ecosystems for youth-led innovation in health.
Good morning, everyone. Good morning, everyone. I was just walking inside this room and I saw a lot of friends. I see Prof. Lagat there from Moi. I see Dr. Princess from KNUST. I see Prof. Asefa from AAU. So before I get started, I just want to recognize my wonderful colleagues that I get to work every day from the 9 institutions. So if you're in this room, please stand up. Wonderful. As I was waking up this morning, I was wondering, what am I supposed to say? And especially after you come in last, right? Because if you're talking about policy, it's already been spoken about. If you speak about the role of higher education institution, Prof. Osura has already spoken about it. Dr. Givinji highlighted the role of PHC as a backbone for healthier ecosystem. And so I was wondering, what is my role here? But I sat down at around 2 a.m. That's when I woke up today. And I said, let me twist it a little bit and do a reflection. So I was born in Maralal in Samburu County. I'm seeing Prof. Lakati here. That is in the northern part of Kenya. And for most of us in this room, if you're from Kenya, you know what that part is, right? You understand that education and health is no certainty in that place. But what gets you out of that place is opportunity. We can all agree to that, right? Reflect where you came from. If you came from Ruhango, if you came from Limpopo, if you came from somewhere in the northern part of indigenous Canada where they experienced the same challenge, just think about it. What takes you from that place to another? What takes you from point A to point B is opportunity. And maybe somebody said yes to you, whether that's education, whether that's entrepreneurship. And for me, as I stand here, I recognize the power of education, because once you start, for people like us who did not have access to things like entrepreneurship, we are pastoralists. So the only thing we see is cows and goats, but that is for wealth, not to be sold. But then education gives you the power to be outside, to be exposed to more than you've ever seen in your life. And I'm seeing a lot of people here in this room who came from different parts of this continent that you've seen, because you were able to acquire education, things that you should not have seen if you stayed where you stayed. So what am I saying? That at the MasterCard Foundation, we recognize that despite where you come from in life, you deserve a chance. You deserve somebody to say yes to you. And that's why we always say, we want to ensure that we can solve the unemployment challenge in the African continent. And one of the ways we do that is through higher education institution. And as Dr. Edwina mentioned, in 2021, while we were sitting in a room, it was a Zoom meeting, we asked ourselves, what is the role of higher education in driving primary healthcare? Because at that time, the MasterCard Foundation was not working in the health space at scale. And so we sat down, we co-created programs looking at how can we be able to bolster the health workforce in the different countries that we work. So you will find within our programs, we have from community health workers, which is at the base of the health workforce pyramid, to the top, which is we have people who are training us, fellows in emergency care. We have doctors in public health in the different institutions. But also we said we are responding to the supply side of the economy. You've been trained. What happens to the demand side of the economy, right? How can I be able to get a job after I graduate? And what we've recognized, as Prof. Osur said, we've trained and trained and trained. You are a doctor, you don't have a job. What is it that higher education institutions can do to be able to support and enable a business environment where somebody from Chotera, the border of Uganda and Tanzania, can be able to think about a business model, whether it's in the agriculture, whether it's in health, whether it's in the digital economy. And so you will find that most of us seated in this room, particularly the young people, we are looking at innovations in health. You will, and Dr. Duncan calls it health entrepreneurship. But also we recognize that we cannot do this without the ecosystem. So who sits in the ecosystem? I see a lot of investors in the room, people work in the government. For a curricula to be developed, you need the government to approve it, right? And so that's the power of the ecosystem. And so as the foundation, what we're trying as much as possible is to look at the power of the private sector, the government, the higher education institutions, but at the center of it all, it's the young people that are seated in this room. Why? Because we recognize if you are able to provide an enabling business environment, financing, mentorship to somebody in Turkana, the innovator around maternal and child care, they're able to employ other young people, you're reducing an employment challenge, and also you're catalyzing the health ecosystem. So we're not just working in one way, we're trying to solve a 360 approach. So as we sit in this room today and we start this AfyaFest, we hope that this is where we're starting the movement. And to do that, we want to thank the Amref Health Africa and the Amref International University for saying yes for this first AfyaFest, but also a commitment from the MasterCard Foundation, as we've done since 2021, for the next 10 years of this partnership is to continue to be agile, to be flexible, and see where do we need to support and scale the innovations that are coming out of this collaborative. Thank you so much, and looking forward for more conversation.
Thank you, Emanuela. I would say Emanuela has brought us full circle when she talked about identity and who does the university, or who do we grow up to be through our school system? Do we grow up knowing that we are going to be employees, or do we grow up identifying as employers? And how can we make that shift? That talent is everywhere, but opportunity is not. That education, and more important, learning, has the power to shift this. That we need to take a multi-sectoral approach, the power of collaborating between private and public sector, between government, young people, universities, etc. And I think when, Emanuela, you spoke about what challenge the foundation is focusing on, solving the challenge of unemployment in Africa. I think when we hear that, many of us wonder how. It is a big, audacious, bold vision that you're addressing. And I think I will end with a quote that I love based on this vision, that not failure, but low aim is the sin. Aim high. Thank you very much to my panelists. Let's give them a round of applause. Yeah, oh, please, Emanuela, let's take a photo, and then we can. Thank you.
By the way, yeah, you can smile. Yeah, and it doesn't have to be. This is a young room, right? Okay, let's see your most youthful pose. Let's go 1, 2, 3. Thank you very much. Please a round of applause for that amazing first panel. Thank you very much. I think they deserve a better round of applause. Makofi Kwatavali as they take their seats. Carolyn, back to you.
Thank you. It is now my distinct pleasure to invite our keynote speaker, Ms. Kanini, to the stage. Kanini is the Managing Director for Europe, Middle East, and Africa at Draper Richards Kaplan Foundation, where she leads investments and support portfolio organizations to scale their impact across Africa, Europe, and India. And let me tell you guys, this is just the tip of the iceberg. She is so accomplished. I don't even know how I would speak about the things Kanini has done. I would need the morning. She's not just an investor. She's also an entrepreneur. She's a speaker. She's a board chair, member, advisor to numerous ventures across the world. She is the real deal. And you know she's an investor. So ventures, you know who you need to be impressed. I'm so pleased to welcome my friend, Kanini, to speak to us this morning.
Well, thank you, everyone, and thank you so much, Carol. You always introduce me with such flair. I wish I could live up to the introduction. Firstly, this is such an amazing room. You all make me feel so old, and that's going to be my first disclosure. I am not a young person. I am middle-aged, and I am proud of being middle-aged. So just to make my first disclosure before we start, but fantastic to be here. And thank you very much, Amref, and everybody for organizing this first fest. So I wanted to start with a bit of action in the room. Firstly, who else in this room is an investor? I cannot be the only one. So by show of hands, who invests in health innovation? Okay, we've got one. Wow, AfyaFest, 2, 3. Okay, out of these, how many of you are commercial investors, not grant makers? Wow, okay, so we have 2 in the room. Okay, next time AfyaFest, we need more investors in the room to connect the capital to their innovations. One other question, how many in this room are looking to raise capital in the next 18 months? Fantastic. It looks like a big group in the room. How many of you are willing to raise commercial as opposed to grant capital? Fantastic. That's a very good sign. Okay, I'm in the right room. Okay, so good morning, everyone. I wanted to start by saying, I think the MC mentioned that today the conference or convening should actually be a launch pad, and I agree with that. You know, at my age, I have done so many talk shops. You know how you go for conferences, you leave and nothing happens? Hopefully that's not going to happen today. I want to challenge you all either to leave this room, those who've put up their hands with an intention to raise capital, please leave this room with at least 1 or 2 contacts or things you have to do to get that capital raised. For those of you who are looking to scale your innovations, leave this room with at least a clear intention to scale your innovation. Now, before I begin, let me talk a little bit about my employer, right, Draper Richards Kaplan, because I think it's important to understand who we are and what we do. So we are a global impact investor. I run the Africa business and the Africa portfolio as well as the European portfolio. And what we do is that we simply believe that bold social entrepreneurs like you can solve the world's most intractable problems. Okay, so that's what I live for. I raise capital, and I basically put that capital where it needs to go to solve the world's most intractable problems. Now, we invest early, okay, as opposed to many investors, when the risks are highest and where pathways are unclear. Yeah, I know a lot of investors who do not believe in investing early. We come in early. We do all the difficult, hard work with entrepreneurs to get them to grow and to scale. What do I do with my day-to-day life? I do hands-on work with our innovators. I help our innovators refine models, build their teams, build leadership, and scale sustainably. Now, we've been investing in Africa for over 15 years. We just set up the office 4 years ago. I moved from London to Nairobi to set up the office, but I am a child of Kenya, born and bred here. Now, I have to add, our Nairobi, our Africa office anchors us in what I call close proximity to our founders. And I think it was Dr. Asur who mentioned today that you have to be local to be able to understand the problem that you're solving. So that's one thing that we've done, especially since I came into Nairobi 4 years ago, is we do not invest in non-proximate founders, okay? Who understands the meaning of proximate founders? Okay, proximate founders basically means you've got to be an innovator who lives the problem that you're solving, who knows the problem that you're solving from lived experience. Okay, we don't do any more of that expat investing, not this fund. So what makes our approach different? We're proximate capital for proximate leaders. So this morning, there are 3 things I want to do with all of you. This is what I want to share. First, I want to share stories with you. Yeah, stories of DRK's innovations, who we've supported, and why. Because I don't think as investors we do enough of a job of talking about the things that we've done well or that we've done badly. I also want to give you a bit of insight about how we select our entrepreneurs. That's another thing I think investors don't do very well. How many of you have been told no by an investor in the last 12 months, or funders? Who's been told no? Were you told why you got a no? Were you told why? What was the reason? Not being mature enough. Okay. Did that sit well with you? Okay. most investors will just say you're too early. That's like a catch-all phrase for just, no, we're not ready to do it now. But what I will share with you today is clear criteria of how we select our founders, how we decide to back the ventures that we back. And then lastly, I'll pick up on some of the comments that were raised earlier this morning, and I'll talk about what I think it will take for all of us funders, investors, governments, young innovators to truly scale primary healthcare across the continent. So let's frame the problem. You know, one of the reasons why I moved back to Kenya from being, living in the UK for many, many years was the urgency of the problems that we have on this continent. Okay, Caroline mentioned that I do a million things. Why do a million things? I do them because I really and truly think there is so little time to solve the problems that we have on Earth. Maternal health. 178,000 mothers die each year giving birth across the Africa region. Imagine that. I have 3 children, and I can just imagine what it takes, right, to give birth in an institution, in a hospital that takes care of you and gives you the right kind of care. Mental health, this is one of my most focused areas right now, especially from a DRK standpoint. 29 million Africans currently live with depression, okay? Sorry to give you such sad news. And suicides currently are at 11 per 100,000 people. Dr. Su also talks about that in terms of what happens when you study and you have no options. NCDs, Dr. Givinci mentioned this, 1.6 million people aged 30 to 70 are dying each year across the continent. So people, we have problems, right? Especially young people, we have real problems. And as I talk about these statistics, I want all of you to think about somebody in your life who's had to go through what I just talked about. Somebody who's died because they didn't have the right care, somebody who's died because they didn't have enough money to pay for care. These are things that we live every single day. So how are we solving this problem at DRK? Why am I doing this crazy, difficult, big job? So our aim at DRK is to back extraordinary health innovators. Okay, and I want to give you some examples of the ones that we've backed, and some of you may know these organizations. In terms of mental health, we've backed 3 organizations in the last 8 years. Friendship Bench in Zimbabwe. Who knows Friendship Bench? Put up your hand. Okay, not enough people know it, but they're doing some amazing work providing healthcare, mental health care through trained grandmothers sitting on a bench. Okay, we started off as a grassroots organization, I think with a budget of 100,000. Our budget now exceeds over $10 million a year. And we're reaching over 400,000 people a year, just in Zimbabwe. We also invested in Strong Minds in Zambia. Who knows Strong Minds? The Zambian contingent, who knows Strong Minds? 1 person, fantastic. So they also provide mental health care, and they're reaching 856,000 people every year just through providing mental health care. And then our most recent investment is Shamiri Health Institute based in Kenya. Who knows Shamiri Health? Oh, at least we have more. Anybody here from Shamiri Health? No, okay. Same thing, but they focus on mental health care, but for young adults within the school system. That's something that DRK really feels strongly about, that one of the best places to provide mental health care is within the school system, with the participation of parents. Mental health, maternal health, we've also done a lot of work. We invested in Jacaranda Health. Is Jacaranda Health in the room? Fantastic. It was 10 years ago, so it was a different founder, but I think Jacaranda Health is probably one of our proudest investments. They're now doing a hybrid model. I know you're raising capital separately from the NGO, and I think the last number I saw was 2.4 million women that you've provided maternal care. What's the number? How much? Fantastic, 3.4. And do you know how much we invested 12 years ago? $200,000. I mean, that's the best use of capital you can ever have. So fantastic. Jacaranda Health was one of our earliest investments on the continent in maternal health. One other company I'd like to share about is South Africa. We have a lady from South Africa here. We invested in Vula. Vula is a specialist access platform that connects health workers to specialists. You know them? Yes, we invested about 6 years ago, and we now have about 38,000 health workers using that platform. So I'm super proud of these investments, and the reason why I'm mentioning them is I want you all one day, 5 years, 10 years from now, to be one of these companies that I'm talking about. Okay, proudly talking about impact numbers. Who thinks they're gonna get there? Fantastic, and you will, if you find the right capital, the right investor, and the right model to scale. So how do we pick these innovators? Do I just toss a coin? Do I just wake up in the morning and decide who looks like me, who talks like me? No, we have a set of criteria that I really want to help you all think about as I go through it. So it's not a checklist, it's a series of questions that my team and I ask ourselves. Okay, so the first question. Is the founder truly rooted in the community that they serve? And I'm going to repeat that question. Is the founder truly rooted in the community that they serve? We have some fantastic founders who come to us who are living in Seattle and they're trying to solve a problem in Zambia. That will not work. That is not a proximate founder. So my advice to all of you is please do make sure that you are rooted in your community and living the problem that you're trying to solve, because you will not find the right solution if you are not in that community. The other question we ask ourselves is, does the founder have the courage to push against entrenched systems? Yeah, these are questions we ask ourselves as investors. I'm sure you're waiting for the big profit question. No, these are the questions we ask even before we start to do diligence. Do you have the courage? Can you push against policy? Can you push against political will that goes against your model? Those are the types of founders that we want to deal with and back. The third question is, are you an adaptable founder? On this continent, in the world, policies are shifting all the time. Markets are changing, capital needs are changing, capital sources are changing. We only back resilient leaders. And it's actually very easy to see that when you first have a conversation with a founder. I like to say that one of the tests that I do before we invest is what I call the stuck in an airport test. Who knows that test? Okay, this is something for you to think about. I think about, how would I feel being stuck in an airport with this founder for 6 hours? Would I be engaged talking to them? Would I be interested in maintaining a conversation because this is a resilient individual who really understands and is passionate about what he's doing? Or would I be dead bored? Okay, that's what I call the stuck in an airport test. The other question we ask ourselves is, does the model have the potential to scale? Now, this is a really important question because innovators come to us with grassroots ideas, okay? We don't back grassroots ideas. I'm not, unfortunately, interested in a solution that is only going to serve 100 to 200 people in a village. That's not what my capital is for. So please, when you come up with a model, make sure that it is based on a strategy to scale beyond where you've started. And then the last question before we go into diligence is, can we trust this leader, this founder? Does this leader and this founder have integrity? Do they share our values? Do they carry the thought and the weight of the communities that they serve with them? So I'm sharing this because most people imagine that investors come into a room with a profitability motive, but as an impact investor, this is where we start. And I'd like everyone in this room who's aiming to raise capital to really think seriously about the questions that I have posed, because this is how you're going to get to the next level. Now, I'd like to just share from a personal standpoint, the reason why I do this work is because I have a responsibility to leave a legacy when I die. You know, I'm old, I'm not as young as you, so I don't have that many years left on this earth. But one thing I am certain of is I really do want to die knowing very well that I served the entrepreneurs and the founders on this continent, and the capital that I raised went to making a difference. So that's why I do this work. I think one thing to talk about is, obviously, we need government in the room. Do we have government and policymakers in the room? Who's here from government? Are you shy? Okay, one person from government. Where are you from? Which ministry? KMTC, Kenya Medical Training College. Welcome. I think we do need to have more government folks in the room. That's another piece of feedback. As you can see, I give feedback as I go along. All the organizations that I just talked to you about that we've invested in have all partnered with government as part of their scale strategy. Okay, you cannot scale without government. Government is not a hindrance. Government is probably one of the biggest payers that you will have when they're able to pay. Okay? That I accept. But the key thing is governments need to be not just regulators, but collaborators with you. For example, Friendship Bench is a good example. They are now part of the national mental health strategy process in Zimbabwe. Strong Minds is part of this health ministry's mental health care strategy as well. And we as DRK really see this as part of the reason why they have scaled. So I've sat on the boards of these organizations, and one of the things that I do regularly is sit with the ministries of health in each individual country. So here's my call, my closing call to action, all right? After 5 years, what story are we all going to tell each other? Will there be another AfyaFest? Will there? Absolutely. I need a stronger yes. There will be another AfyaFest. And at that AfyaFest, the innovators in this room, I want you all to say to yourselves, I will be part of the stories at that AfyaFest. I will be part of the AfyaFest, okay? This is not a talk shop. We're looking forward 5 years from now. As somebody here in the room said, the choice is ours, the call is ours, and the floor is ours. We're at the right age, we're at the right place, and we're on the right continent. So everybody, thank you so much for listening to me. This has been an absolute pleasure, and I hope you'll take something away with you. Thank you.
Thank you very much. Please, a round of applause for Miss Kanini Mutoni. I think she deserves a better round of applause. Makofi kwake tafadhali. Thank you very much. And please, I'd like us to please put our hands together for all our speakers that have come before her. Please, a round of applause for them as well. And Tuseme Asante. Now, ladies and gentlemen, I'm really excited because the tone has been set perfectly. And I loved when you asked who's in the room that's looking out to raise capital, and literally everybody's hand went up. Now, ladies and gentlemen, we're going straight into another session. But before we do that, I'm going to give you an opportunity to do something. So please, I'd like us to kindly be up on our feet. So do me a special favor. Beautiful. Now, this is what I want you to do for me. I'm going to give us, it's 11, so we have until 11:05. It's a hard start, it's a hard stop. I want you to look around the room for somebody that looks very interesting that you've thought, I'd love to have a conversation with that person. So 1 minute to do that. So look out for somebody in the room. Shake their hand. Just go meet them. If they're not where you are, just go meet them. This is me plugging you in probably to the judges. This early, by the way. Just shake their hand. Don't say anything just yet. Just shake their hand. Next thing I want you to do is, I want you to ask them, what do you do? What makes you special? And why are you at AfyaFest 2025? It's a 2-minute conversation, by the way. So meet somebody, shake their hand, introduce yourself, find out what makes them special, what makes them so interesting, why are they here, tell them about your project, tell them about what you're building, Tell them about what you think about Nairobi so far. You have 2 more minutes. Take your time, you have 2 minutes to go. You have 2 minutes to go. If you came with whatever you want to show them, if you can't get a contact, we were told to get a phone number. This is your opportunity to get that phone number. Ms. Kanini told us you can get a phone number, you can get a contact. This is your opportunity to get a contact. You can do it in 2s and 3s and 4s. It doesn't really matter. One last minute. Remember, you're building up for lunchtime. That is going to be probably your partner over lunch. One last minute. Get that phone number, guys. Find out what makes them special. How do we work together? That's an amazing question you can ask, by the way. How can we work together? 30 seconds to go. 30 seconds to go. 30 seconds to go. You should be getting your number now. 20 seconds to go. All right, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Ladies and gentlemen, please a round of applause for yourselves for being amazing. A round of applause for yourselves. All right, please take your seats. Take your seats kindly. Take your seats kindly. Thank you. Beautiful. Take your seats kindly. Thank you, guys. Thank you. The guys are right here in the middle. Thank you. Was that worthwhile? Did you meet somebody interesting? So this is what's going to happen. Randomly, I'm going to be giving you an opportunity to meet somebody new because we are only here for 3 days. And some of you have traveled from so far, and it will be so unfair that you only know the people that you came with, right? It's an amazing opportunity for you to also build your social capital as well. Now, ladies and gentlemen, allow me to welcome our next amazing moderator for the next session. For this one, get your jotters out. If it's on your tab, this is a proper learning session. But the person that's going to be moderating this particular session, in addition to being such an amazing individual from ALU, she is also an amazing rapper. Oh, I can drop your YouTube videos. You want me to do that? So she's a rapper, she's an artist. So my DJ is probably going to give me some bars so she can drop a little bit of some bars here in a little bit. But as we get ready to do that, now, ladies and gentlemen, for some of you, you've asked me about internet. Can we please have that projected up? So as in Kenya, we call them Msani. As my Msani gets ready. So please, if you can put the QR code, or not the QR code, sorry, the Wi-Fi password. That is your Wi-Fi password. So you can select conference or access code. That, of course, once you click on the Wi-Fi sign, and that is a password. So what I'm going to suggest for you, yeah, perfect. Take a picture of it so you can keep it and actually carry it with you. Before I also call my next, or rather my moderator, 2 beautiful countries that were omitted from my list. I'd like us to specially celebrate Switzerland that is with us today. Where is everybody from Switzerland? Switzerland, please stand up so that wave at us so that there we go, please, a round of applause. And there's only one representative from the beautiful kingdom of Morocco. There we go, thank you. That being said, allow me to welcome to the stage our moderator for this next session. Please, a round of applause as we welcome Miss Laura Mugambi as she comes up on stage. Please, a round of applause for her.
Yeah, we're good. Working. Hi, everyone, again. It's a pleasure to see all of you. He's really set me up. Well, I'm not a rapper, more like a singer. I did a bit of there's one particular song where I did try a bit of rapping. I have worked in the entertainment scene a little bit, more just like exercising my gift. I appreciate what Ms. Mutoni said about, dying empty, literally leaving everything that you have here on this earth. Do not go to your grave with anything. So I've done a bit of singing, and if I look familiar, I was on your screens for about 3 years on Citizen TV, if you're a Kenyan, on the Sunday show. So currently, I work at the African Leadership University as the lead for the health employment pillar. If you know about the pillars, which is why we are here, courtesy of Health Collaborative. So we have health employment pillar, health entrepreneurship pillar, and the health ecosystems pillar. How I got here is because I have very keen interest in nutrition and health promotion, which is my academic and career background. It's my pleasure to moderate this session right about now, which is literally going to be comprised of a powerhouse of expertise at the intersection of health, policy, and enterprise. So welcome to this plenary session on health as an economic sector. As everybody has reiterated, we've had a really great opening session that has really brought us full circle into why we are here at AfyaFest and what we are here to achieve, what we are here to do. And I really appreciate also the emphasis that this is not a talk shop. It is a space for us to build and scale going forward what we're doing here. So across Africa, the health sector already employs millions, drives innovation, and creates investment opportunity. Yet its potential is far from fully realized. So when we reimagine health as an economic sector, we need to begin to see it as a cost to governments, not just as a cost to governments, but as a powerful engine for jobs, business models, and technologies that transform lives. So like I said, I have a great panel of trailblazers shaping the future of Africa's health economy. And so I'd like to introduce them one by one, and kindly, when I introduce you, feel free to join me on stage and take a seat so that we can start this session. Firstly, I'd like to introduce our first panelist, Mr. Desmond Milia, who is the Senior Ecosystem Manager in Africa for Bridges for Billions. He is an accomplished investment professional with a rich background in evaluating projects across multiple industries, from energy and real estate to innovative finance structures. He brings deep expertise in financial due diligence, investor relations, and building ecosystems that unlock capital for impactful ventures. So please welcome Mr. Desmond Milia. I need heavier claps for my panelists. Amazing. Karibu sana, Mr. Desmond. Our next speaker is an innovation strategist and an investment advisor with experience spanning business consulting, financial modeling, and market research. Currently serving as director for Health Tech Hub, he helps innovators across Africa commercialize health solutions, raise capital, and scale their impact. So please join me in welcoming Mr. Emmanuel Momani. Karibu sana. We're also honored to have a strong youth voice on this panel, Ms. Laurie Stembo, who represents the Youth Africa Coalition under the Africa Health Collaborative, where she champions the role of young people as creators and drivers of health solutions. She brings a fresh perspective on how grassroots engagement and youth leadership can position health as a powerful economic sector. So please help me welcome Ms. Laurie Stembo. Joining us as well is a global health investor and venture builder who has worked across Africa and Latin America. He currently leads social business and investments at Boringa. I'm going to have him to say that word himself. I can only say Boringa, and I don't think I'm saying it right. And is managing one of the largest corporate health funds in underserved markets, already reaching over 50 million people. With a track record in venture building and frontier innovation, he's passionate about creating capital pathways for health impact. Please help me welcome Mr. Andrew Gwadiva. On to number 5.
Boringa Ingelheim.
Oh, Ingelheim. Now I'm based in Rwanda, so I'm trying to learn Kinyarwanda And now, which one is that? What's that? German. So now I know a bit of German. All right. On to our fifth panelist is a seasoned consultant currently with the Boston Consulting Group, where she focuses on homegrown solutions and strategies that strengthen Africa's development agenda. She has previously led the World Bank's disaster risk financing project for pastoralists and consulted with Dalberg and McKinsey on issues ranging from education and gender to economic development. Please help me welcome Ms. Sylvia Mwangi. And last but not least, we have a healthcare leader who brings both clinical and business acumen to health system strengthening. As General Manager for Clinical Services at Equity Afya Group, she oversees operations, healthcare innovation, and digital transformation. With a background in healthcare management and promotion, and an MBA in healthcare management, she represents an intersection of health and enterprise. Please help me welcome Dr. Joyce Sitanik. All right, I have done the best to introduce our panelists. Like I said, it is a very rich panel. It encompasses voices that reflect the full spectrum of what it takes to reimagine health as an economic sector. And so this is more of an interactive session around the panel, just to get to hear different perspectives and views as the innovators in this room look to make great changes in Africa. So I'd like to kindly start with Desmond, Mr. Desmond Miller. You have all your mics, great. Desmond, how do you design incubation programs that empower innovators to move from ideation to viable health solutions, keeping in mind that many things do die at ideation? How do you design programs, take them from ideation to viable health solutions, and what metrics do you use to track and measure success?
Okay, thank you so much. That's an excellent question. So we at Bridge for Billions work in the very early stage, all right? We work with entrepreneurs who are not necessarily at stage 0, but at stage 1, all right? So you have an idea and you've done something about it. What that thing is varies, of course, from entrepreneur to entrepreneur. But we realized very early on Bridge has been there for about 11, 12 years. We realized that some of the difficulties being faced in the latter stages of acceleration and growth and mobilizing fundraising for healthcare entrepreneurs especially was a problem with pipeline. So investability of some of these startups was a problem. So what we said was, why don't we go in at the very early stage and de-risk a lot of these ventures? And that involves going in early, identifying the viability of the business models, looking at the entrepreneurs, can they deliver on their innovations? Because the African healthcare space is rife with very unique challenges, right? So for example, as Madam Mutoni mentioned, do you have the courage to drive through the obstacles in regulation, in licensing, in certification, for example? Do you have the patience, for example, to push through your innovation in an unpredictable and challenging business environment with power problems, infrastructure, et cetera, where in healthcare, for example, as opposed to other industries, you have the challenge of needing your capital to be uniquely patient, right? Because of the regulatory challenges we've talked about. So we saw an opening at the very early stage to intervene with the entrepreneurs, to come in and say, why don't we fix, rather than wait until you're in the acceleration phase or you're raising follow-on funding, what can we do at the very, very early stage to make sure that your business models are viable, that the team is well equipped, that your technology makes sense, that even before we get there, that your solution is applicable to the problem that you've identified as a very elemental problem. So what we do is we work with corporate partners, we work with development organizations to design incubation programs that we don't deploy ourselves, but we deploy through entrepreneur support organizations. And why do we do that? We used to deploy them ourselves, but then we realized that if we're going to have the impact, the scale that is intended, we don't want to seem, because we're headquartered in Madrid, We didn't want to seem that we're coming with an European solution to an African problem. It's not going to work. So we deploy entrepreneur support organizations in the markets in which the impact is intended. So if we work with X corporate, and then we say, okay, we're looking to advance the cause of maternal health care, prenatal, sexual and reproductive health, wherever the case might be. Who are the actors, who are the players in those environments? What are the incubators? What are the university hubs? Who are the entrepreneur support entities in those environments that we're looking to have an impact in? And then we deploy them to effect that change. Recruit entrepreneurs. We want to see the applicability of entrepreneurial interventions in the delivery of primary healthcare solutions. So some of these things are important to us, and we're making a very deliberate, very intentional push into Africa, the healthcare space especially. So in the past, we have been industry agnostic, but in Africa, our mission is to improve the delivery of primary health outcomes. And we do that through delivery of high impact, contextualized, nuanced support to entrepreneur support organizations that support entrepreneurs. So we might not do it ourselves, but there are people in those communities who have the contextualized knowledge, who know the entrepreneurs and the challenges in those ecosystems that are able to deliver that help that is required. So that is how we design incubation programs. Some of the things we track, we are very insistent on unit economics, for example, in the healthcare space. So what that means, of course, varies from entrepreneur to entrepreneur. But so there's two types of metrics. The first one, the first bucket of metrics, you call them scale-oriented, scale metrics, for instance. So those ones are mostly in the latter stage. But in terms of business, unit business metrics, for example, cost per patient, cost per partner onboarded, all those metrics we track, we make sure that the solution that you're building as an innovator, the solution that you're trying to present to the market, is viable in the market that you're looking to build. Some other things that we track are equitable distribution of your solution across different geographies. We also track, for example, if you're building a product, if it's about screening, if it's about devices, whatever it is, are your unit economics in order? So that is what we do towards de-risking some of the health innovations that come through our pipeline. I hope I answered the question.
You did. Thank you so much for that, Desmond. And very early on, as you were answering the question, you mentioned something about policy. And I want to now move to Emmanuel, because I think as we progress through this conversation, we really, and Ms. Mutoni has also highlighted on the essence of that. So from your work at Health Tech Hub, which policy or regulatory reforms have had the greatest impact on accelerating pilot programs with government or Ministry of Health, for example?
Thanks for that. Can you hear me? Okay. By the way, fun fact, I was in the same class with Desmond, and he was the smartest student. And you can tell, he was the smartest student in our Kishiro class. But it's a pleasure to be with you in the same panel, Desmond. So let me take a step back. The first thing is, to see reforms within policy takes a lot of time, right? You're actually dealing with governments, and we know governments to take time before they actually adopt or make changes. And so at the Health Tech Hub Africa, what we did was to begin with providing governments evidence, because governments really love evidence. As long as you're providing them evidence, they're able to, or they're willing to act on it. And so we began with a landscape study to basically identify gaps within the existing policy frameworks. And out of that, the result of it was a policy blueprint. And you can go on our website, Health Tech Hub Africa. You'll find a version 1 of our policy blueprint. We're working on a version 2. And ideally, the blueprint helped identify key areas that were gaps to government, but also were barriers to innovation, right? And so to startups, you can go and check the 4 areas we're working on. That is licensing. We have coordination, so helping investors, government, and other ecosystem players to better collaborate. And then there was one around harmonization of policies around the different countries in the continent. and then data governance, stuff around interoperability, privacy laws, and all that. So we discovered that in different jurisdictions there are gaps. And so when we put together this policy blueprint, we also set up an intergovernmental work.
Oh, maybe.
I can shout. Yeah, I hope you can hear me. Yes. So the idea was that our intergovernmental working group will use it to then advocate for changes in policy to create an enabling environment for all the startups that we actually support. And governments actually, right now our intergovernmental working group is made up of 20, but at the time when we were launching our policy blueprint, we had 16 governments that actually adopted and validated our policy blueprint. And what we've seen is immediately after actually we launched the policy blueprint, which was sometime in 2023, we had governments like Nigeria developing their EHR standards that are actually in the final stages. The result of that was basically they used our policy blueprint, looked at some of the gaps that they had, and discovered that they needed to work on their EHR laws. We've had governments iterate on their digital strategies, and we've had governments like DRC that have actually come to us and they need support to then work on their first iteration of the digital strategies. But then you look at countries like Zambia, Tanzania, Nigeria, they are in like their fourth iteration of their digital strategies. And so basically our intergovernmental working group has then played a role in which countries can come together to help each other either learn from one another to develop these laws, but also our startups that we are supporting, because at the core of it, policy is just one pillar of what we do. We also have an acceleration pillar. We provide business support, business support and product development support as well. So when you're merging all these two, you are able to then help startups align with the priorities, even the standards that we are supporting these governments put together, ideally see them early or discover them early, prepare for them early, so that by the time we are coming to, say, the Nigerian government, the startup has already followed all the standards that we've worked together with the government of Nigeria to adopt, and we've worked with this startup to then prepare them to develop or align their solution to those existing government priorities and standards. So ideally, in a nutshell, it's been a journey, and it's really difficult to see results in the short term because we've only been operational for 4 years. But cases of like Nigeria adopting or setting up their EHR standards, having DRC, Tanzania doing the third iteration of the digital standards, and all these are governments that are actually coming together, and all this is happening within our intergovernmental working group, we could consider that as some level of success.
Yeah, I think what I'm getting from you, and it's been said over and over, is really as an innovator, you have to be patient. Now in Kenya we have, everywhere we say ladies first, but in Kenya sometimes we say ladies first, men before. And that seems like what I have adopted here, because I do want to go to Andrew, but don't worry, we're flowing nicely. And Andrew, you lead one of the largest corporate health funds targeting underserved markets. And my question to you is, what innovative financing structures have you seen that effectively de-risk, just as Desmond was saying, investments in health startups, making them attractive to mainstream investors?
Thank you for the question. And I'm actually happy to see one of my portfolio companies here, Naum, Benacare. So I'm happy to see her, maybe Naum. So the best people in the room, and also we've also invested in, that's Benacare, we also invested in Jacaranda Maternity, yeah? I don't know if there's any other founder here. Yes, but yes, we are one of the active investors in the healthcare scene, yeah? And we are quite vocal and we are quite hands-on in what we do. That's Boringa Ingelheim, yeah? In the stage alone, we work closely with Will Grow Africa. They run our accelerator programs. We are going to work closely with Bridge for Billions, Afya and the team, yeah? And also Sylvia and BCG. So we're quite vocal with what we do as a corporate itself. Now, when it comes to the instruments, I was shocked. Kanini has said everything on stage, yeah? So I will not add anything to what Kanini has said, but I'll just say ditto. What she has said is true. I'm now shocked with the number of the few commercial investors in the room. So Maggie, wherever Maggie is, we need more investors in the room, because the reality is that aid is moving away from Africa, yeah? The US is looking inwards, Europe is also looking inwards, yeah? So that brings in the space of commercial investors, brings in the space of impact investors, but impact investors who are thinking about longevity, yeah? Impact investors who are quite strategic and will hold your hands. So that is what I'll expect each and every founder to think about. So we deploy in different ways, yeah? By partnering with Will Grow Africa, we support the ventures that Will Grow Africa will onboard with grant funding, yeah? But for us, that is quite short-sighted, because that's more of catalytic funding, and that's something that we're telling more corporates to be part of, yeah? Through the catalytic funding, we have the investment readiness. And what is investment readiness? It's more strategic. It has to have a more strategic approach. What are the gaps that you are having as a founder, and how can we help you with those existing gaps? Everything Emmanuel has spoken about when it comes to government, let's say government relations, when it comes to the first big customer that you have to onboard, that is something that we believe in, yeah? And also, so I've been a founder before, yeah? And one of the things I remember, one of the things that I saw by being a founder is that you'll get all kinds of support, especially in Africa, but little money to help you with that support, yeah? That was such a pain. But with Boringa Ingelheim, what we are saying is that we are getting you as a founder, yes, and one of the things is that we're going to be quite strategic with the support. Tell us 3 or 4 existing gaps, and we are going to help you with those existing gaps with some catalytic funding. And that's something that we are also telling investors to tailor, yeah? So that's at the beginning. But remember, I said that's quite short-sighted, yeah? Benacare, really, really good case study. You should talk to Naom about this, yeah? So beyond that, beyond being part of the program, we also come in as your first investors, yeah? So our sweet spot is from around 1 million euros going up, but we come in and talk to you and think through with you, especially when it comes to how is your next 5 years or 7 years going to look like, yeah? Do you need more customers? Do you need government relations? And also beyond that, what kind of partners will you need so that you are self-sustainable? So financial sustainability is really, really key for us, yeah? So that's when we come in. So of course, after the program, and that's what we're also telling other investors, yeah? You need to talk to founders to understand, you're not supposed to pitch your criteria, rather you need to understand where they're coming from, and if you're able to, tailor the financial instrument according to the founder's need. We're quite vocal about that, yeah? If it's an impact debt conversation, have an impact debt conversation. If it's an equity conversation, have an equity conversation, but also advise the founder.
Do you want to try?
No?
Here we go. Yeah. Hello. Yes, because we need, I'll end by this, because we need, we have to get to a place whereby, especially Africa case, so we invest across Africa, we have to get to a place whereby it's the investors that are pitching to the founders and not the founders pitching to the investors. Mm-hmm. We need to get to that world whereby more investors, because we are working for the founders. So it's as clear as that. And by working for the founders, you need to think about what exactly does the founder need, yeah? Patient capital, I mean, things to do that like that, the right kind of partnership. So get into that place. But anyway, on how to de-risk is creating an entire ecosystem around the founder, understanding the founder, understanding each and every specific need, being hands-on. We're seeing a lot of investors, especially health investors, who just invest and wait for their return, yeah? So we're quite vocal, and we have our own community of investors where we're telling investors, listen, let's then work together and help you figure out, especially when it comes to investments and how exactly you'll handhold the founder. But yeah, those are the couple of points.
Thank you so much, Andrew. Yeah. And as we shift into hearing more of the female voices now on this panel, you have Andrew has talked about Florence, yes. Andrew has talked about, you've talked about the changing times, yeah? Funding is changing, especially for health. Things are shifting. And I'd like to hear from you, Florence, as a young person working at grassroots level. What are the biggest barriers you'd say young people are facing when trying to translate ideas into real-world health solutions? And what do you see as an opportunity for spaces like AfyaFest to create opportunities for young people to look into skilling, resources, and all that they need to make their ventures successful?
Thank you so much, Laura, for that question. I will start by echoing on what Kanini was asking in the room to say, how many investors do we have in the room? How many founders are in the room? So for me, I believe this should have been an environment where we have investors, because we are having young people that have innovative ideas coming to this place. One of the greatest challenges that young people face is access to financial support. Financial support is the biggest challenge that these young people have. They have their ideas. They do not have a platform where they can showcase their innovative ideas. So for me, I believe financial support is one of the things that young people are struggling with, but also the mentorship aspect. Even if we give financial support and there is no mentorship for these young people, it is as good as setting them up for failure. But if we offer mentorship, Kanini also mentioned to say, as we leave this world, we need to leave empty. So it means she's willing to pour into other young people. So what are we willing to pour into these young people? What mentorship are we offering to them? How do we help them become successful? And being successful is not only on the financial aspect. It is the mentorship, the day-to-day guidance. How do you run your business? What do you need to have a successful business? The other issue would be, on the Zambian context, we have cultural barriers. So especially with coming to the health sector, young people who want to bring innovations in the health sector, maybe let me speak about sexual reproductive health. This has been a very challenging conversation to have in Zambia with regards to sexual reproductive health. So even the innovations that young people will bring up will be faced with systemic barriers and cultural barriers, because we are not open to the idea of innovations relating to sexual reproductive health. So if we can create an enabling environment for young people to bring out their ideas, connect them to the right stakeholders. As Young Women in Action, what we do is we connect the young people to the duty bearers, to the decision makers, so that even as they bring policy on the table, it is something that the young people have spearheaded and are saying, this is the change that we want to see. We do not want, there's this saying that we go by, nothing for us without us. So we believe that for any innovative ideas that our governments are coming up with, we need young people to be seated at the table. One other thing we offer also is mentorship. Mentorship in the aspect of leadership, because we believe that for us to achieve this success for young people in health economic sector, we need them to sit at decision-making tables. And how do they sit at decision-making tables if they have not received the mentorship on how to be a leader? What we encourage them on is leadership does not come with a title. Leadership starts within you. You do not have to be given a title as ambassador or anything else for you to be called a leader. You are a leader where you are, but you need someone to guide and mentor you and bring out that leadership out of you. For AfyaFest, like I mentioned, I feel the opportunities that should have been here would have been an exhibition for young people, young innovators, and the right investors in the room to see what's the ideas that young people bring to the table, and have investors that say, I want to tap into that idea, but not only financially, as I mentioned, also guide this person by providing mentorship. How am I going to help them grow without just waiting for the aspect of me getting out my returns after they scale up their business? Be there for the young people. One of the other things that I would speak to what my government has done is we have this fund that we call the Constituency Development Fund, CDF. This CDF has an aspect of youth grants. So these grants are given to young people that want to start up businesses. So this is something that we could also adopt in other countries, have a grant for young people so that they are helped with financial support to start up their businesses, because starting up could be very hard. Though one of the other things that we are targeting is to have tax evasions for startup businesses, because in as much as they have the financial support, the taxes are very high for them. And that is equally setting them up for failure, because 2-3 years down the line, not even 2 years, they don't even get to the threshold of 3 years. 1 year, the business is dying. Why? Because of high taxes. So we need systems that can create an enabling environment for young people to thrive. And this can only be done if we have a human face put to economic development. We want to see our young people thrive. We want to see Africa go high. And how do we do that? By coming together, by collaborating as Africa Collaborative. Come together, mentor young people, pour into these young people. Do not die with the information you have. Do not go with the knowledge that you have. Speak to us, but also to the young people. It is a challenge. Find yourself with the people that have the information. Get to them. Ask them how they got to where they are and how you can tap into the knowledge that they have. Because as young people, for the longest time, we complain and say, we are not given a seat at the table. My friend and I make this joke to say, if we are not given a seat at the table, we will sit on the table. So I challenge you young people to sit on the table if there is no seat. Find yourself in those spaces. Do not wait for them to call out to you, but be the one to reach out to them and say, I want to tap into the knowledge that you have. I want to learn from you. Do not just be interested in the financial aspect that they can give to you. They have enough knowledge that they have acquired over years. Tap into that knowledge. Thank you.
Thank you so much, Florence. Thank you for sharing that. And now I'd like to move to Ms. Sylvia Mwangi, because why we are here is because long term, we're really hoping for a time where Africa can be a global leader in innovation. And your work with Boston Consulting Group, for example, with the HGS Accelerator, you can talk a bit more about that. But my main question to you is, how can we bridge the gap between innovation pilots and national or continental adoption so that good ideas don't remain stuck at pilot stage? Once these barriers have been broken and young people have what they have to come up with ideas, how can we make sure that these ideas are being adopted and they are growing?
All right, I will contextualize homegrown solutions and then get to answer how we move from pilot to scale in the 2 or 3 minutes I have. So at BCG, Boston Consulting Group, we coordinate a homegrown solutions accelerator. It is funded by the Japanese agency, JICA, and it's part of the Africa Union Development Agency, out in EPAD. So think about policy, think about funding, and then there's BCG and Vilgro Africa that brings in the technical expertise. And in one word, we separate health enthusiasts to health entrepreneurs, right? So you have been running for 2 to 3 years. You have some early traction, but how do we shake you off and make you move from an enthusiast who loves health and wants to impact community to actually somebody who is a real entrepreneur in the health space, right? And that ties to the question of what does it take to scale a business? So we typically will take seed or Series A kind of investments. No, not investment, businesses that are at a seed or Series A. And we really look at, do you really have a value proposition for the people that you're working with, for the community that you're interacting with? Do you know how to segment your customers? We have many of our typical entrepreneurs that come in and say, I have conquered Nigeria, I want to come to Kenya. When you ask where you've conquered Nigeria, you have conquered 2-3 villages and now you're ready to come to Kenya. Or you have conquered a village in Nakuru and you really now want to go to Tanzania. I'm sorry, but then we come in and tell you, no, there are things you need to figure out before you think about scaling. There are questions about governance that you need to think about scaling. There are questions about who are your competitors, how do you position yourself rightfully, and then we can get you investor ready. So getting back to your question about what does it take to move from pilot to real scale is clarity on exactly what you are offering as an entrepreneur. And speaking to a lot of the young voices in the room, do you have clarity on exactly what you're offering the community? And with that clarity, as many speakers have spoken to, you are going to be moving against the grain, because there's a reason why we are at current status quo and things are not necessarily working. There are hurdles that you need to go through, and some of those hurdles is a clarity in the strategy within which you're going to achieve that particular objective. The clarity within kind of strategic partners that you need to have before you can go to the funders, right? There's a whole question about there is no funding, but before we get to the funding conversation, let us be true to ourselves that there is a lot more that needs to get to be in place before we are having a funding conversation. Have you had conversations with potential customers? We actually have one of our select companies that we did support this year, and this is, let me speak about them for a minute. This is an imaging center that we first interacted with in 2022. They're based in Cairo and have expanded to 9 countries, and they're imaging more than 1 million scans annually with 300 hospitals in the continent. So that's the scale at which they're operating. And they believe they have a clear value prop to the different hospitals. But then we went to the hospitals they work with. And, no, I'm not sure. Is it about the pricing? Maybe not. Is it about the turnaround time? Maybe not. It is just across I want to say about the steadiness within which that particular image comes and the accuracy within which it comes. But in their mind, it was, we are able to give you a scan quickly, we are able to give you a scan cheaper. No, I can get a local doctor who can give it cheaper. So if you lead with a wrong value proposition and you don't understand who you're going against, then I'm sorry, that scale is not going to be achieved. And this particular company now, when we supported them in 2022, had conversations with big players like Johnson & Johnson, had conversations with big players that have been able to connect them, Siemens, GE, and the scale at which they're operating today is cognizant to what their customer segmentation, government hospitals, county hospitals, a private imaging clinic, all have different needs. And then you're able to sort of say, this is your offering to these different kind of tiers of customers that you have. That level of understanding and appreciation of what you can get into helps you lend yourself, even as you have investor conversations, that you are able to meet what the investors are looking for and you're able to position yourself correctly. Last thing I'll speak about is governance. Governance in how the entrepreneurs are running their business, where the founder and the different brains that have come together to execute the ideas and the people who are running it are not necessarily clear on the different roles. And governance plays a critical role in when you think about moving from 10, 15 employees and you're thinking about hundreds of employees. If that is not captured correctly, then that scale is also not going to be achieved. And then out and EPAD and the different stakeholders that we work with then helps us to enable about WHO pre-qualification, FDA accreditation, to really get you to the place where you are going to be scaling. It does indeed take a village to be able to think about scaling solutions. But clarity in what you're offering, clarity in what differentiates you, then the money follows becomes a critical conversation. And the Homegrown Solutions is here to help you think through those kind of challenges. Thank you.
Thank you so much, Ms. Sylvia. Thank you. And as we move gradually towards the tail end of our conversation, I felt that it would be very great for us to end with hearing from you, Dr. Joyce Titanik, because you work with Equity Afya, which has pioneered a franchise model for healthcare delivery across Kenya, which is one of the most successful, if not the most successful. Can you speak a little into what inspired the approach of Equity Afya, and also speak a bit about the balance between profitability as a health venture or business and making your services affordable and accessible to the people that you're targeting?
Thank you. Thank you. It's really a pleasure for us to be here. And even before I speak about our inspiration at Equity Afya, what I'd like to say is, when I've listened to all the speakers before me, I want to attest that all the things that they're saying, actually, they work. And when I was looking at our enterprise, I mean, we were ticking a lot of the boxes that they were talking about. But I'll explain that a little bit more. So Equity Afya is a brainchild of the Equity Group Foundation. Equity Bank is one of the leading banks in Africa, for Africa by Africa, currently in about 8 different countries within Africa. And the main aim for Equity Bank and Equity Group is socio-economic transformation across all the countries that they are operating in. It's also about giving dignity to the Africans that live within the continent and are trying to make a difference in their lives and in their communities. So we have 3 major engines. We have a commercial engine, which runs with the bank. We have a sustainability engine. And lastly, we have a social engine. And the social engine is called Equity Group Foundation, actually represented here by Dr. Patricia and Jesse. Maybe you could just wave your hands. And this is our social impact engine. And looking at complementing the commercial angle of it to making real impact in the communities that we serve. So amongst the pillars, we have about 7 pillars in the social engine Equity Group Foundation. One is the education pillar, and this is where our story actually starts. We have a scholarship, we have 2 main scholarship programs, and you may have heard of them for those in Kenya, the Equity Wings to Fly scholarship program. And that one targets the most vulnerable students in our communities who have excelled in their studies despite their challenging living conditions and social conditions, and picks those students and gives them a fully paid scholarship in partnership with the MasterCard Foundation, enabling them to go through a high school education and you know, continue with their education. But let me just stop there for a moment. Last year, and just to explain how that fund works, we were launching one of our 136 medical centers in Kenya in Bomet. Bomet is about 250 kilometers from the capital city of Nairobi. And as we were launching that clinic, one of the community leaders who'd been invited to help us open the clinic said, by the way, Daktari in Kiswahili, there's something I just wanted to mention. We have been a part of the committees that chooses the vulnerable students to benefit from the scholarship. Last year, we chose one student that really touched my life personally, touched me. Imagine this student was the best performing in their local primary school. They came from an orphan family. And when we went to visit the family, because it's part of the process of onboarding the students, we found that their grandmother had recently gotten amputated. Their sole breadwinner had been amputated both legs because of the complications of diabetes. I mean, if a sorry case can't get any sorrier, it does. And sometimes it's the person, sorry, sometimes I get emotional when I think about this, but that one last person that everyone was counting on to make a difference. And the disease comes out of nowhere. Cancer, diabetes. You're barely able to put food on the table. And your only source of hope is gone. So that's where inspiration comes from, you know. Health is great when you have it, but takes away a lot. It drives families back economically. That one guy who managed to get people out of the rut, the family out of the rut, is gone in a flash with a heart attack. So what we saw was that we needed to have a solution that enabled access sooner rather than later to healthcare that makes a difference. And so we had the Equity Afya founded under the Equity Group Foundation. And what we do is, through a franchise model, we are establishing medical centers across the country. And now picking back from the other story, that boy who went through the scholarship program goes through high school successfully, and if he still maintains his performance in school and is best in his county, he then gets another scholarship, the Equity Leadership Scholarship, that then enables him to go and study medicine or any other course he wants. For those who study medicine, they come back and then get the rights to open an Equity Afya medical center, funded 90% and secured, and supported by the Equity Afya franchisor, which is where I sit. We help them figure out where the location of the clinic will be, the policies that they need to operate in, governance, IT systems, human resource, we help them hire. We help them buy the key inputs, the medications, etc. You're starting from zero, but you're buying into a system that already works. So the success rate of our facilities is actually above average because of that support. But then what does it also mean? That you may not need to spend that capital that you're getting from the bank to set up some of the key operating input, like buying a system, etc. You're moving right into the business of the day, which is to see patients and ensure that you're driving impact. Now, there was the story about proximity. One of the things that has worked for us is that we pick students from every county. And so these students are more inspired once they qualify to go back home and set up the facilities. We've been to places where you'd call them no man's land. In the local language, it's called, we say, shamba la mawe, as in when you go to a farm and it's all rocks, there's no prospects of getting anything out of there. It's not initially commercially viable in all the locations that we go. But we are able, through the surpluses we get as a franchisor, to set up facilities in hard-to-reach areas in partnership with donors, etc., to enable us make sure that no corner is left behind. I'm telling you right now, we have Dr. Ambani in Peketoni, and 1.5 years in, he's been able to break even his facility, and now he no longer needs our help. And we can take back our fund and use it for some other location. We have Dr. Leturju in Samburu. We have Dr. Polycarp in Oyugis. We have Dr. Yaro in Marsabit. All parts of the country have been reached. And we are now thinking about how do we go even deeper into the communities to enable them to access affordable healthcare. On average, the cost of care is about 30 to 40% cheaper than, or more affordable than other comparable private healthcare providers. And we thought that this would actually have the highest impact in the cash-paying patients, patients who access healthcare without insurance, only to find that at the end of the day, the biggest buyers into our program was actually the insurance companies, saying that we think that the benefit that you're giving to our members actually extends their covers longer than they would in other private hospitals. And so we want to have more of them coming in. That's one. Two, we then started to ask ourselves, why then is the unmet market of cash-paying patients not able to access our facilities? Then we realized cash is still a big barrier to health access. And so we've had to think back as a group and see, then we need to make insurance accessible. Cash alone is not a sustainable way to access healthcare. And so we've launched our Equity Health Insurance, which is really breaking the norms around insurance access and deliberately trying to remain affordable to ensure that everybody is part of this. Lastly, if we are to think about impact, on average in a month we see about 100,000 patients. We've seen about 4 million unique lives so far since inception. We started in 2015 as a pilot program with USAID. And then after a proof of concept, we've been able to scale up from the initial 5 to about 140 in total. 136 in Kenya, actually it's 141, and 5 in Kinshasa, DRC. We've just crossed the first border into DRC because we believe that our solution will make a difference in healthcare in Africa. And the people driving these solutions are the same scholarship beneficiaries who not only just build their first clinic, but are even able to scale to have more than one clinic being owned by a single doctor. And maybe I could acknowledge the doctors who've been a part of the Equity Afya franchise group. I think there's Dr. Elizabeth Mwangi and Dr. Gideon Karaoke sat somewhere there. Maybe if you could stand up and wave. And we have Dr. Elizabeth Gitao as well. Yeah. It's real life examples and it works. And scale sometimes sounds like a good to have thing. I mean, like maybe the investors are trying to get back their investment. But let me tell you this, scale is what keeps the whole idea running. Scale, if with all, it's unfortunate what's happening with USAID. If we were still dependent on the USAID fund that started our first 5 clinics, there's no way we would have been at the current 140, making the level of impact that we have right now. There's no way we would still be aspiring to grow to the 1,000 clinics by 2030 in Africa if we did not crack a sustainable, a self-sustaining model that gives benefit not only to the doctor who is investing in that facility, but also to the communities that they are serving. I submit.
Thank you so much, Dr. Joyce. If I don't know if this is the same feeling around the room, I hope that it is, but this has been a really empowering session. I just wrote a few adjectives as they were speaking. I would define this as a rich session, an empowering one, a relatable one, a passionate one, and one that resounds with the hope of possibility, right? There is a lot of possibility. So as we appreciate them, can I teach you something, LU style? Right? LU style. So LU, we? So I want to hear a thunder of snaps across the room to appreciate our panel today. Thank you so much for making the time and for the amazing insights that you shared. Asante.
Thank you very much. Please a round of applause for Laura as well. Thank you very much. Now, before you guys actually exit the stage, we'll take one amazing picture together. Laura, you can sneak in into this one as well. Give me your best pose, your amazing smiles. And I'd like to welcome Caroline just to join me up on stage as we... All right. So So don't exit just yet. We have a special gift for you guys. So please, let me have you on stage. Carol is gonna join me up. So let's just move on in. So Carol, you sway. All right, so it's not just you guys. So thank you very much, Mr. Desmond, Asante Sana, Dr. Joyce as well. Thank you, Emmanuel, Andrew, Mr. Andrew, Miss Florence, Miss Sylvia. I also want to welcome up on stage Miss Kalini. Thank you very much. Please a round of applause for her. She comes on up. Miss Emanuela, Professor Edwina, Dr. Gethinji, Professor Joachim, and Dr. Christine Mutonyi. Please a round of applause for our first session. They have been phenomenal. Carol is going to join me up on stage just to present a small token of appreciation to all of them. Thank you so much for traveling so far. Thank you so much for preparing so well. And of course, on behalf of these amazing individuals, I think we have been well fed in this first session. So we have a special gift for all of you. So Carol is going to help me present. Don't worry. We'll try and sneak in this as fast as possible. All right, let's go. Beautiful, beautiful. Please a round of applause for them as they get a special gift. This is going to be you in the fifth one, yeah? This is going to be you. You come through, share about the amazing, amazing, amazing impact that you've had. No, don't. We take one picture. Don't be in a rush. Picture ni leo. So just wait just a second. Just hold on a second so we get one amazing picture with all of you together. Beautiful. Yeah. Some of you are peeking into the bags. Don't worry. It's good stuff. Don't you worry. It's some amazing stuff. Beautiful. Then I'll ask us just to come closer to Pamoja. Let's just squish in a little bit so that we can get one gigantic picture. All of us together. Thank you. Thank you. Please, one more time, ladies and gentlemen, for this amazing.
Thank you, Mr.
Were they amazing? So if they were amazing, please do it much better. My coffee quote of that. Round of applause for all of them. Beautiful. So let's just try and squish in a little bit so that we can all be one amazing, loving family. Beautiful. Yeah, I see what Carol is doing at the end. There we go. Smile, guys. Beautiful. Thank you so much. Thank you very much to you all. Thank you very much, Carol, as well. Now, ladies and gentlemen, next thing I want us to do, very, very, very special. I want you to give me your honest feedback of this first session. I think for now, you've already logged into your internet. We're going to use that heavily, by the way, in the afternoon. So I'm going to put a QR code up on stage, or on my screen, rather, so I can have the QR code. Sorry for that. Beautiful. So I want you to scan that kindly. I want you to just give me your honest feedback, okay? Rate me the best, by the way, okay? So just give me your honest feedback so far. How has the session been? This was session number 1. So scan your QR code. Please give me your honest feedback on that. And as we're trying to get that in, please, as you exit this room, you will get your meal vouchers, your lunch vouchers, because we're not coming back up until after lunch. So that essentially means a lot of you guys will have to carry what you came in with if you're not going to be in the session that is here. And then we are all, or most of us will be going to the 6th floor. Okay? Somebody help me do it in French. How do you say 6th floor in French? 6e étage. Parfait. So we're all going to the 6e étage. 6th floor. So that's where all our breakout rooms are going to be happening. And outside all our breakout rooms is where you'll be able to see what thematic area is in that particular session. Now, lunch will be in the adjusting room for some of us, but we also have a spillover that's going to be in the 6th floor. Now, just to highlight what is where, breakout room number 1 and 2 on the 6th floor, maternal and child health. Breakout room 1, maternal and child health. Here in the plenary, this particular location, so you don't need to go anywhere, is where we will be having the NCDs, this particular facility, so you don't need to go anywhere. Breakout room 3, climate and health. Breakout room 4 and 5, global health security. I'll take that one more time. Maternal and child health, breakout room 1 and 2. Here in this particular facility is NCDs here at the plenary. Climate and health, 6th floor, breakout room 3. Global health security, also on the 6th floor, room 4 and 5. So the only one that is here is NCDs. All the rest are going to be on the 6th floor. All right? Have you finished with your survey? Did you give us your honest feedback? Perfect. So if you need a little bit of some energy, don't you worry, the food is in plenty. There's a cup of tea or your cup of coffee. You can collect it and go with it to your particular facility or where you're doing your next meeting. It's exactly 12:07. We expect you to be done with your breakout session in an hour. That's give or take in around 1:07, thereabout, where you will proceed immediately for lunch for another hour. That means at exactly 2:07, we should be back here, seated, ready to start wrapping up the day. And we have some amazing surprises for you in the afternoon. Okay? Any questions? Beautiful. So, ladies and gentlemen, bon appetit. Enjoy your coffee, enjoy your tea, enjoy your snacks. We have some of them outside, but you can grab them as you head on off. Thank you so much. You guys have been phenomenal. All your translation material, you can leave them on your seat. Just leave your translation material on your seat. All your gadgets, you can leave them on your seat. That is for translation. Your laptops, you can go with them, what have you. Just the translation equipment. See you all in exactly 2 hours. Enjoy your lunch and have a fruitful deliberation during your breakout rooms. Thank you. Remember, all is happening on the 6th floor. 6th floor. 6e étage.
administration. And I was particularly interested in this session because my very first internship after graduating was forged in non-communicable diseases. So I'm really passionate about this area and getting to learn from our stellar speakers on the lineup. So I hope they are in the room or somewhere. First up, I would like to call upon Dr. Catherine Kanari, who is a seasoned, Dr. Catherine? There we go. She is a seasoned global health practitioner with over 18 years of experience in the health sector. She currently serves as a universal health coverage lead at Amref Health Africa, where she provides technical leadership and drives the implementation of large-scale programs across Africa and Asia. Her expertise spans HIV/AIDS, TB, NCDs, digital health, capacity building, health financing, and primary health care. With a strong focus on NCDs and health system strengthening, Dr. Kanari is dedicated to improving community health and well-being. She is a passionate advocate for health equity and sustainable development, committed to ensuring that communities have access to essential care. Through her work, she empowers healthcare professionals and builds stronger systems to address emerging health challenges. Welcome, Doc. Next up, I call upon Noam Wanari from Bena Health, Bena Care. Noam Wanari is a social health innovator and founder of Bena Care, an award-winning social enterprise in Kenya. She started it to bridge healthcare gaps and has scaled it to a network of over 3,000 healthcare workers providing life-saving care. Welcome, Noam. Next up, we have Dr. Daphne Ngunjuri, the CEO of Access Afya, who leads efforts. Dr. Daphne leads efforts to deliver affordable, high-quality healthcare in Kenya, leveraging her medical and management expertise to improve efficiency and outcomes. Welcome, Doc. Next up, we have Moses Waweru from Volgrove VC, Africa. Moses, is he in the room? Hi, there we go. Moses holds an MSc in Global Health from the University of Manchester and a Bachelor of Business Administration, specializing in entrepreneurship from the Kenya Methodist University. He has diverse experience managing health research and intervention programs covering areas such as substance abuse, mental health, HIV/AIDS, health promotion, behavior change programs as well. He has held senior roles in several nonprofits, including Private Sector Development Trust, the Institute of Quantity Surveyors of Kenya, and SCAD. Welcome, Moses. And last up, we have Dr. Clara Mugambi. Dr. Clara, there we go. Dr. Clara is the director of 47C Holdings, where she has spearheaded the introduction of high-quality organic fertilizers from Georgia to the Kenyan market. Her work provides farmers with sustainable solutions that enhance crop yields, improve soil health, and reduce pesticide use. Under her leadership, these innovations have achieved yield increases of up to 80% and stronger soil structures, contributing to healthy crops and higher quality produce. Dr. Mugambi has successfully navigated market challenges through strategic leaderships and partnerships, rigorous testing, and a steadfast commitment to farmer success. Welcome, Doc. Okay, so Dr. Catherine, to set the scene for us, in your experience and in your work of integrating NCDs into primary healthcare services, what have been the key success factors and pitfalls to watch out for, especially when you're considering scaling to other countries?
Thank you. Good morning, everybody. Or it's afternoon, actually. Good afternoon, everybody. When we look at non-communicable diseases, we are looking at chronic care models. And so a lot to be learned even from our successes within the HIV field. And so one of the key learnings, I'd say, is around sustainable financing. for healthcare and specifically around non-communicable diseases, ensuring that any programs that we are looking at are then integrated into existing systems, but also identifying that there's an increase in NCDs within African context, in as much as we also have the communicable diseases. So some of those learnings look at how do you make it sustainably financed to get your chronic care, looking at insurance, looking at pooled procurement for commodities, and the usual challenges along the supply chain for non-communicable diseases. So those are just a few examples, but also trying to focus heavily on prevention, as it's usually definitely cheaper than treatment. So that's what I'll say around the learnings. And then also ensuring that we learn how to then cost that care for patients who are either stable or unstable, so that they can be able to sustainably be factored into our social health insurance systems. Thank you.
Thanks, Doc. And just to continue on that trend, how can young health innovators best position themselves to contribute to universal health coverage for NCDs, especially in terms of aligning their solutions with national health priorities and government regulations?
So, thank you. I think innovation is the bane of science. And so as young innovators, the thing is to look around your solution. What gap are you solving within that space, UHC and NCD? Are you looking at diagnostics? Are you looking at perhaps innovative solutions around supply chain, innovative solutions around patient care, patient prevention and patient chronic care follow-up? Looking at also how does it integrate into your national systems? So are there, for example, digital health platforms that you can tap into? How do you then bring in AI, looking at prevention, looking at treatment, and actually patient care? But also critically looking at capacity of healthcare providers. We have a system that's heavily built around communicable diseases, because that's what used to kill us in Africa, more or less. Still kills us, but NCDs are catching up. And so when you look at our hospitals, more than 70% of inpatient care is around NCDs. So when you're looking at that, that's a huge problem that we do need to then focus around. And ensure that even as you innovate, the solution you're creating is not more or less piloting. It is something that can be scaled. So trying it out to scale as it's already a public health issue. And so the other things to look at as young innovators is the space, digital space within your country. What are the data protection laws? What are the digital health sort of pathways? And how does that integrate into data? Because the other big piece around this is data. How do we get good data to prove our case or to show that we need to focus on NCDs? So when you're looking at a solution as a young innovator, look at the gap that you're trying to solve. Is it for one person? Is it for multiple people? Is it scalable? Is it contextualized towards your, I'd say, context? There are some countries where we look at digital innovations and don't factor in that data is a cost. And data costs a lot in some countries. The disparity between access to internet in African countries is actually massive. So those are some of the things I'd consider when I'm looking at solutions from young innovators. Thank you.
Thanks, Doc. And now that brings me to the perfect segue to digital health and transformation. So moving on to Dr. Daphne. Automating the back end for a scalable health operations system requires data discipline. Where does your biggest challenge lie in designing the analytics and incentive structures, especially for motivating that patient behavior change?
Yes, so this is a bit of kind of broad question and a big problem I think anyone here can kind of understand. But I'll try and address it in three parts. So the first is infrastructure, and also from our own experience in building these systems. So infrastructure, and the readiness for the adoption of that infrastructure, adoption by the key users, but also the investment by the companies that are building these. So one of the core challenges has been a kind of what I call a Frankenstein of technologies. how do you integrate them to create that interoperability? Because the fact of the matter is, many of these systems, and we're starting to see more and more of them emerge today, but 15 years ago, when Access AfyaFest started, there were very few fit-for-purpose technologies that we could use. And while we were keen on technical adoption very early, we used a combination of different technologies, so patient record management systems, inventory management systems, telehealth platforms. So the question then remains, how do you integrate this seamlessly? How do you keep the costs affordable in order for this to scale while maintaining the fit-for-purpose objective? That said, fast forward 15 years later, many companies have now emerged with technologies that are suitable for the operations in these parts of the world and kind of workflows and healthcare practitioners that will be using them. And also, within the ecosystem that they operate. So the question still remains, how do you integrate and track patients towards the achievement of our goals around patient outcomes? To do this, we're a tech-enabled company, we're not a tech company. And so this required partnership with thought leaders in the tech space to think about how to integrate their technologies and this kind of middle layer of technology that creates unique identifiers for individuals regardless of the system in which they entered their care pathway. And that will then create the ability to track patients from the first point of contact, whether that was through a community health worker who screened an individual in the community or in their home, to a physical visit at the clinic, to long-term and longitudinal visits of an individual over time, or whether the patient engaged digitally through their own device. So a unique health identifier can track patients across all of these platforms and bring them together. So thinking about the way that the infrastructure is put together, ways of unifying this information, and more importantly, also connecting it to national health systems can be quite complex to navigate, just because the pace of the way these things are moving is very different in the public sector, in the private sector. But it's still something I think that continues to be a challenge, but one has to be quite aware on where it's going and figure out the possibilities of integrating that. So today, what we have is what we call a health CRM. So this tracks a patient from the first point of contact through to their outcomes. So for diabetes, this session is about non-communicable disease. One of the areas that we did start the development of these care pathways is with diabetes and hypertension, in collaboration with Boehringer Ingelheim, who were actually in the panel earlier. But so we have community health workers screening individuals and identifying risk. We found that there's a huge gap in access to information about diabetes and hypertension, what it is, why am I affected, how does it present, why should I be concerned about this, what can I actually do, and using that information to have a community-led design. So we're taking those beliefs and understanding of what this health issue is and translating that into solutions for individuals. Once patients then convert to care, we're able to then track conversion and non-conversion, high-risk, lower-risk groups. We're able to track adherence to care, retention in care, all the while continuing to engage individuals with information, health information targeted to their stage or their unique needs. And then tying this back to, again, things that benefit our users, our patients. And these are things like diabetes and hypertension costs can be quite significant to low-income households who we serve. And so we also have to think and innovate how to align incentives to achieve those health outcomes. Some of the things that we do is if we've incorporated loyalty programs so that we're able to retain and engage patients longer, because we understand that their journey with us is going to be longer. we partner with organizations that are able to provide what we call smart subsidies to individuals, so to help them incentivize future visits or additional diagnostics that might be needed, that might be difficult for them to pay for out of pocket. And lastly, with insurance companies that can help also cover that risk.
Thanks, Dr. Daphne. And you mentioned diabetes and hypertension, but what other NCDs are you noticing incidents of?
Yes, so we typically follow the same approach, and this is to the kind of idea of scalability. Is following the same conceptual approach from screening, risk identification, conversion, and management.
Mm-hmm.
And of course, escalation of care, because we focus on primary health care. And so our key role is to identify and find risks, manage or prevent the ones that we can, and in a timely manner, advance the care of people who need a higher level of care. And so from a kind of framework, from diabetes and hypertension, we've been able to replicate that against, amongst other care pathways, so maternal and child health as well. We're able to replicate it for mental health, another kind of a condition under the mental health group. And through that, just like the diabetes and hypertension, you're able to unlock access to care that you would previously have to send somebody away from their first point of contact to a tertiary level of care. And that integration, I think, is very important to bring care closer to where people are. When we, what kind of led to this motivation is still linked to the kind of community-led design approach. And when I say community, I mean the people who are, the services are designed for, but also the healthcare workers who are going to give that service. A resource-rich source of the gaps, because they're the ones who are going to tell you, we refer diabetes and hypertension patients every day to a higher level of care. They just don't go. These are their fears, these are their concerns. And you can start to take that information and use that to design or identify gaps that we as the business can help to bring closer to where people are. And so in keeping costs low as well for patients, which is one of the barriers. I don't understand what the costs are going to be at a higher level of care, and that's going to keep me away from following up with my referral. But being able to integrate those services within primary care through the use of technology, then you can make them more affordable, you can make them more accessible, and still maintain that role within primary health care of triage and prevention.
No, thanks. That's clear. Thanks, Dr. Daphne. And now talking about taking healthcare to patients, moving on to Naomi, how do we offer home-based nursing care and lease essential equipment, which is sometimes very expensive to procure? And how do you balance quality assurance with the affordability, sustainability, and equity in the services that you provide?
All right, thank you. So maybe just to provide context of how home-based care comes in, the company that I run, that is Benacare, offers, we're in a mission to lower healthcare costs. And this is because, just building up on what Dr. Daphne has said, non-communicable diseases, their nature is long-term. And then they have this ability to bankrupt families emotionally, financially. And so what we do in this space is providing nursing services in the comfort of the patient's home. And this is for patients with non-communicable diseases specifically, because then we will provide it over a long time and then lower healthcare costs for them. And then leasing of home care equipment such as hospital beds and concentrators, ventilators to them, so that they avoid the burden of upfront payments for these otherwise very expensive equipment. And then the third way is by taking mobile dialysis services to patients with kidney disease, chronic kidney disease in rural Kenya. So just to answer your question, what we have been able to do from a point of sustainability for both Benacare and the patients that we serve is that we have made sure that we look at the logistics of providing the care to them. Because when we provide home-based care, it means that you will have a patient to nurse ratio of 1:1. So the patient has their own nurse at home. And for us to achieve this affordably for the patients is that we map out and then we get the nurses closest to the patient. So we have over 10,000 nurses registered with us, so that if a patient calls from village A and then they need care there, we get them a nurse from around there so that it lowers the cost of travel. And then, you know, there's the distance, there's the time that it takes to get there. And then the second way is through training of family caregivers. So as we offer the nursing services, which will average between $15 and $26 a day, which is still high when you look at low-income families, is as the nurse comes in, they are training the family caregiver who is taking care of the patient on the aspect of supportive care. Because mostly as you practice nursing, you'll realize very quickly that 60% of nursing care is supportive. It is feeding the patient, it is giving bed baths, it is taking vitals, it's supportive care. So as the nurse is training the family caregiver, they will finally go out, and then the family caregiver will provide the supportive care, and then the nurse will only come in for service monitoring and clinical care at a lower cost, just clinical care, service monitoring, and then go serve another patient. So this way we reduce the cost of care further for the patients. And then whatever they pay Benacare, we pay 70% of it to the healthcare workers who are working, and then we retain 30% so that we are also operational in the side of the administration. And then for the list of home care equipment, we've managed to build a very big inventory of hospital beds, of ventilators, of oxygen concentrators, and how we ensure that we can be sustainable both ways is that the cost of lease allows for us to recoup the full value of the equipment between 6 months and 8 months of the lease. So we are able to recoup the full value of the equipment at that time. Most of the equipment have a lifetime of 3 years, so that is good for us before we start replacing a lot of things like motors and stuff. But we already have the cost of having biomedical engineers to service the equipment as it goes. So this way, the patients don't have, for example, I'll give you an example of a ventilator going for about $12,000 or 1.2, 1.4 million Kenya shillings, but we lease it out at 90,000 to 170,000 per month, depending on the type of the equipment. I'll give you an example of an ICU bed. This is a 5-function electric bed going for about 270,000 Kenya shillings. That would be about $2,500. We lease it out for 30,000 to 40,000 Kenya shillings per month. So if this patient needs it for 3 months, it would make more sense for them to lease it instead of purchasing. And for us, we will always lease it out and then we'll recoup the full value. Yeah.
Oh, thanks, Naum. That's truly inspiring. And in terms of next steps for Benacare, where do you see the scaling in the next year or two? Where do you see Benacare going?
Currently, we are more focused on helping write a blueprint for decentralizing healthcare. We have done this through our mobile dialysis unit, a very highly regulated space, but we were able to work with the policymakers to regulate and to obtain licenses to take mobile dialysis in a mobile truck in the rural areas. So right now what we are looking at with Benacare is to work with government, which we're already working with government, county government in Kenya, just work with the government to write policies for decentralizing healthcare and helping to replicate this model of healthcare across Kenya so that we take care closer to the people as opposed to them traveling to get healthcare.
Thanks, Now. And yeah, I think the discussion around NCDs, sometimes it's not a simple causative factor. It's a variety of complex systemic factors It's also the environment that we find ourselves in that leads to us developing non-communicable diseases. So to Dr. Clara, your work lies at the nexus of agriculture, food systems, nutrition, and healthcare that is critical for preventing non-communicable diseases. How do you see events and convenings like AfyaFest better equip innovators in the room to tackle these very complex systemic and structural issues that we face in society? And how can we take that systems lens and look at the problem more broadly?
Okay, so I think I got the wrong introduction, but I hope to be there. So, okay, just to give context, I am a pharmacist intern. And then, okay, what I do, in entrepreneurship, I am trying to build on diabetes care. We are trying to we have a group where we are trying now to build how we get insulin to the patient. So we are trying to actually build solar powered for now, but we hope to solar powered fridges for insulin storage, but we are hoping to expand to other sources of energy. So, basically, we are just starting out. So I'm starting out in all spaces. I'm a pharmacist intern. I'm starting out also in the entrepreneurship space. So to answer the question, I think for us as youths, as healthcare workers, this is where I am at this point. It's how this platform like AfyaFest can be utilized to make me not actually take entrepreneurship as a second thing, because that's what most people do. When employment fails, that's when I'm looking into entrepreneurship. So this is what we are trying to do. We are trying to start with entrepreneurship just before employment fails. So one thing I am hoping to gain from AfyaFest, for the training, we need it to be directed to the pain points. For example, when we are building the prototype, when we started building the prototype, we are facing a lot of challenges, especially with regulation, understanding how to regulate this, to actually go to PPB and then have it regulated. So we actually need a lot of training, but it's focused on the pain points that we are facing. We're also facing a lot of pain points as youths on soft skills, so on leadership skills. We actually need a lot of training on how to be leaders. And then also I am looking at mentorship. So for mentorship, I am looking at a point where that this platform goes beyond listening to the narratives, but how am I included in the already existing platforms, the people who are ahead of me, such as Benacare? How can I be included in that space to actually learn through in apprenticeship? So as they are doing their regulation, how do they come up with the public-private partnership? Can I be included in that space? Not only to learn from the narrative, but also to learn from the apprenticeship, how they are doing it. Can I be included to learn how to do it? And then now there is access to data. So when you're starting up, when you're doing medtech, you actually need data to convince now your investors. First, you need to convince them there is this gap, and how do I fill this gap? So there is now, how can this platform actually lead us to access that data? Could they be, can we have training on how to collect data? Can we have platforms whereby they have actually subsidized for us to actually read this, to actually learn about how to collect data, how to analyze that data, how to come up with now, after we have come up with a solution, how do we access that? How do we come to look at how our outcome has come in? So how do we, as now as medtech, like when we are in the medtech space, how are we learning now from the data that we are collecting? For example, for diabetes, this is what we would look at, like after we have now bridged the gap about now the about the access to insulin. How do we look at this outcome? How have we accessed our patients? How many patients have we reached? Okay, now that is what I would like to gain from AfyaFest. Thank you.
Thank you. Thanks, Dr. Clara, and my apologies for that mistake earlier. I think that really resonates, especially as we consider the lifetime costs that patients have to incur for medication, whether it's diabetes or high blood pressure medication, or even now those very fancy obesity injections that we are seeing, or even cancer medication. So these are important considerations, and I think it's just continuing to think about these different challenges and ensuring that there's equity in all of the innovations that we introduce into the world. So thank you, Dr. Clara. And now moving on to Moses. So from your portfolio at Vulgro Africa, which early stage startups in NCDs or mental health have shown the most promise in balancing affordability and quality? And what are the common success factors that they ticked off?
Thank you. So allow me to just start by first introducing Vulgro Africa and what we do. So Vulgro Africa is an impact investor, as well as a business incubator and accelerator. And we also are an advisory firm. And what we do is that we invest in early stage health and life sciences businesses. And we also provide technical support. So if you are an innovator with a science background, we find that a lot of those innovators usually don't have training in business. So our technical support comes in to provide the training and skills around business. And if you do have business training, often we find that those kinds of people don't have understanding of the sector and the science, so we're able to provide technical support in that way. We have supported over 200 companies across the continent. We have supported companies from as far as Morocco, Egypt, all the way down to South Africa. And we bucket our portfolio into three. We have the health tech or digital health, and then we have the medtech and biotech. So speaking of examples in terms of affordability and quality, Naum here, Benacare, is one of the companies that is in our portfolio that is a really, really good example. And in fact, I think one of the things that Naum has done very well, and she's explained it, is thinking about affordability from the get-go. So her product was designed with thinking around how do we make it accessible by way of addressing cost barriers for patients. But the other thing that she's done very well that allow me to speak on your behalf, Naum, is at this point in Murang'a County, Benacare patients can be financed through the Social Health Insurance Fund, Kenya, which is, in my view, like genius level execution, because Naomi is a private organization delivering services through the public health system and has a partnership with the county that allows the Social Health Insurance Fund to pay her directly, not even through the hospital system, but directly. So what that does is that it addresses out-of-pocket spending. And both Naomi and Dr. Daphne have talked about the nature of NCDs as long-term care diseases and the ability of those diseases to impoverish patients. So it's really important to think about how do you enable and help patients to pay for their care, and that integration with the county is really been critical because it allows for just that. The other thing is, you asked about mental health. We have one of the startups in our portfolio called Thalia. They operate in that mental health space, and they similarly have done, they've been able to also integrate SHIF. And their model is slightly different from Naom's in that their technology is integrated into existing facilities so that they are able to enable healthcare workers screen a triage for mental health issues. And then from that point on, start that mental health care journey parallel to any other physical conditions that the patient might have. So part of what they've done that's really important is integrated in their technology clinical guidelines for management of the mental health conditions, which comes to the third question around what do we see common? So one of the things we see is the ability of technology to address quality issues. So when you integrate clinical protocols for management of certain conditions, and those protocols do exist for all health conditions and diseases, then in a sense, you're able to help the care provider, the clinician, adhere to those guidelines so that even if there was a skill gap or a training gap, the technology allows this care provider to be able to deliver a quality service. The other thing that we see is what I talked about earlier, that you have to think about the care, the quality, and the cost from the very beginning, because it's difficult to fix it later on. So it's really important to be able to design from the get-go for both components, and technology really does help, and one of the ways it does that is through integrating clinical protocols. Yeah, thank you.
Thanks, Moses. And I think a big question this morning in the other conversations, I think infectious diseases tends to get a lot of the glamour and attention around it, but NCDs are sort of back of mind. And now thinking about financing innovators and startups who work in the NCD field, what structures have you found the most effective in terms of de-risking and accelerating these NCD-specific health startups?
Thank you. So we take a blended financing approach, and the way we do it is, for very early companies, we'll normally start off with a grant, and as I said at the beginning, we are impact investors. So we are very interested, not just in the financial returns, but also in the social returns. So it makes sense to deploy grant for those very early companies to help them to build their technologies. In the past, we used to take companies very, very early with prototypes. At this point, we want to see a bit of market validation, and we want to see some initial incomes trickling in, but following the grant, would be a very strong technical support component to address challenges we've identified during the diligence stage. And I really like the point that Dr. Clara made about entrepreneurship as a pathway versus going into employment, because it's critical in healthcare to have sector depth, so that it's not a terrible idea to gain experience in the marketplace first before going into entrepreneurship. But if you have, say, a very strong tech background or a hard science background, our technical support is able to bridge that. So in terms of the approach, we start off with a grant with a very strong technical support component that also includes investment readiness. And this investment readiness component, what it does is, once we've looked at the internal side of the business, we now also want to help this company attract follow-on company beyond our own initial investment. And that includes a number of things: training the entrepreneurs on how to pitch, supporting them to build financial models, strengthening their business models, and that sort of thing. And even actually introducing them to investors. One of the things we're seeing more and more is in the early days, we deployed a lot of equity, but now we're seeing our companies starting to attract debt, which is really good because it's a signal that the ecosystem is really maturing, that debt providers are able to come in and deploy into our portfolio. So to summarize, the blended finance approach involves an initial grant to do some de-risking work with a very strong technical support component, and then a later equity ticket from ourselves, and then supporting these companies to attract from other downstream investors. Thank you.
It's bringing everyone together. Thanks, Moses. And yeah, I think we've covered plenty this afternoon. I would like to open the floor for a question or two, seeing as we have a few minutes. Yes, go ahead.
I'm Dr. Dumisani myself from Zambia, and I have a question for Dr. Naomi. That's in regards to how do your customers find you? Like, how do they contact you? Is there a system you have, especially looking at the fact that you're targeting those who are in the deep rural areas? So how do they know about you? How do they find you? And how does the system work around, especially dealing with NCD?
Thank you. That sounded good, Dr. Naum. I'm not Dr. Naum yet. I'm a nurse. I founded Benacare while I was still a student nurse. So I have proximity to the doctor. I would like to be one in the future. So how we attract patients and how we have done from before is to build a network of doctors into our referral system. Kenya has a very intimate relationship with their doctors. So patients will listen to their doctors because the doctor said. There's something people say in the rural areas, daktari alisema. The doctor said, so the doctor said to do this, I'm gonna do it. So we have built a network of doctors who refer patients to Benacare. And initially when we started with the referrals, we thought the commission we were offering is something big for the doctors and that they would love to refer patients to us, but they actually refer patients to Benacare because they would like to see continuity of care and reduce readmissions So even the doctors want their patients at home to receive monitoring management so that they have better outcomes for their patients. We also do free screening and health education in the rural areas. So we go there, screen for diabetes, screen for hypertension, screen for cervical cancer, and some tests for kidney disease. And through that, we spread awareness of what we do as well. Yeah. Thank you.
Thank you. Emily?
Thank you to all our panelists. So I'll be directing the question to Ms. Naum, founder of Brain Care. So, I mean, I really love the fact that you offer free screening for these NCDs, because in Africa, many people kind of have a mindset of, waiting for them to start seeing symptoms before they go test themselves, do checks on their body and the rest. So what is the approach of Brain Care to ensuring that there's a cultural shift from curing NCDs to now preventive medicine, right? Because where I come from in Nigeria, people are not really used to going on hospital visits. They just assume I'm fine, I'm okay. And NCDs are not like physical injuries that you can see. It's more like an internal disease that you really can't see with unless you go for a proper checkup. So what is Brain Care doing to ensure that there's a cultural shift away from what people think is okay to now having a culture of preventive care before it happens?
Thank you. I would term it as maybe a behavioral shift before it goes to the cultural shift. So what we've been doing, and we've been doing for 4 years now, the free screening and health education, we started it with a grant from Boehringer Ingelheim, thinking it was just something we wanted to do for a few months and then stop. But later we embedded it into our system such that it is now our advertisement budget. So instead of doing billboards and stuff like that, we do free screening and health education. And then we also talk to corporate partners to bring on board resources so that we hold these on a monthly basis in different communities, screening for this. So this is a continuous thing that we do, and I believe in consistency when it comes to shifting the behavioral issues and cultural issues towards prevention. Now, when it comes to the kidney disease, because we are offering dialysis services, which is management, what we have done for the patients and their families is that, number one, we invite family members to come to the place where we are offering dialysis services, and then we do low-level screening. So we could start with something as simple as a blood sugar test and then blood pressure, and then we could go higher to urine dipsticks to just see protein in urine and stuff, and then we go even higher depending on the number of the people we see and what the risk associated with it. So we are trying as much as possible to embed it into what we do on a daily basis, as opposed to something we do on the side. So I hope that answers your question. Yeah. Thank you.
Thank you. And okay, last question, and then we'll wrap up.
Okay. I want to pose this question to the first three speakers, that is Ms. Naomi, Dr. Dafin, and Dr. Catherine. Because most of these NCDs come with mental issues, challenges. Once someone is diagnosed with a chronic illness, they tend to have some sort of depression or some sort of stuff, because it also comes with a financial drainage of the same. So what are some of your organizations doing to curb that mental health challenges? Because most of the patients end up even dying with mental issues rather than the disease that they are diagnosed with.
Thank you for the question. Maybe I can go. So I work at Amref, and most of our work is community-facing, as well as government-facing, and looking at advocacy for the needs that are localized in the communities. And so chronic illnesses, it's like a grief process. So you have to go all the way from denial sometimes up to acceptance. And so that's a critical part when it comes to handling of these patients on a day-to-day. There needs to be that psychological sort of counseling to reach that acceptance level, but to also accept that you might be on this, I think, treatment for a while. And secondly, that it's not quite a death sentence, that it's manageable, and that you can resume your normal function. So one of the current grants I'm handling is around mental health. And so we're looking at integration of mental health into primary care networks within the country. So for Kenya, we have what we call primary care networks, where a facility acts as a referral. It's a hub, and it has several spokes. So within that, we are trying to embed mental health services all the way from the community level up to the spoke, where you get your specialists. And so for that, you have to look at community health promoters or community health volunteers, capacity build them. And what we are finding is there's a lot of stigma when it comes to mental health and mental health conditions. There's a lot of misinformation. And so even as you're looking at solutions as young innovators, those are some of the critical challenges at the ground level. Again, this misinformation is layered with various solutions. Quick treatment that has no scientific basis. So another thing that's cropping up around that stigma and misinformation is AI. I don't know how many have seen this AI prompts that tell you, do you want to get cured from diabetes? Do you want to get cured from this? And so a lot of misinformation coming up even with innovation. And one of the areas that I think for me is critical as we proceed with our future is looking at how two things around AI, how we can use it in terms of agentic support, looking at how do you personalize care for each patient. And then you can also look at it from the misinformation angle. How do we ensure that the information that's given to the populace is actually accurate and true? So whoever comes up with some of these things will be ahead, because how do I make sure? And I know Dr. Githinji, I think, was here. There was a clip before sometime this year of him, his voice, and misinformation around diabetes, talking about onion and tomato, something like that. So we are anticipating that even with the rise of AI, we have the telemedicine, we have digital platforms, misinformation will still be there. And so those are some of the things I'd consider when it comes to even mental health, because what we are finding at that community level, as Africans, curses, you've been cursed, it runs within your family, and a lot of stigma around even treatment of such. And it cuts across the NCDs, because a diagnosis for cancer used to be a death sentence. Now we are living with cancer more and more. So I'd say that mental health needs to then be integrated at each particular level, considering each patient as their own self, as opposed to perhaps a public health approach. And that starts with capacity at that community level and leading up to the facility level. Thank you.
Okay, I think we should wrap up and head to lunch now, but let's continue the conversation over lunch. And then just to wrap up to my panelists here, in one quick sentence, what are your words of wisdom or hot takes to all of our innovators in the room?
To fail, technology started to fail me. So for me, I'd say stay curious, first of all. Keep up with the emergent trends. You can't create something for 2030 when you have a 2016 mindset. So you have to keep up with the trends. You have to keep up with where the world is heading. So looking at other contexts as well. But stay curious, because Africa is wide with opportunity. We are different. Most of these things have been innovated in contexts that were not specific for Africa. And so one of the critical things is to ensure that you're aligning with the context where you're in, but also thinking big, that bigger picture, and looking at your solution from that end. Thank you.
No?
Thank you. So for the innovators and especially healthcare entrepreneurs, what I would say is the surest way to scale at this point is working with government, especially in healthcare, and aligning the innovations that you have with their national health priorities. That helps. And that said, because we have worked in the intersection of making sure that we embed policy and we help write protocols, I would say that policy responds better to evidence. So as a healthcare entrepreneur, make sure you have evidence and engage regulators early, because what we have realized very quickly is when we engage policymakers and you have evidence, the response is better than going in with passion or vibes or whatever. So that would be important. Thank you.
So I think for me, just keeping it simple is for the entrepreneurs, the innovators here, you can and you will. I think just one challenge that I'll give you in these 3 days, from all the conversations that you've had, write down who you want to follow up with and make a point of following up with them. Those conversations will help you shape the way that you're thinking about your business and the opportunities that you have.
I think for me, I'll just piggyback on something Naum said. We receive over 1,000 applications every year. And one of the things that we see is a lot of supply or product-driven innovation as opposed to demand-driven innovation. Very important because demand is different from need. If you develop a product and you take it to a health facility and ask them if they will use it, they will say yes. If you ask them whether they will pay for it, that's another question altogether. So I think it's really important to be able to conduct good root cause analysis and find out, where the demand is and who is going to pay at the end of the day. It's great if the technology works, but because we're talking about entrepreneurship, it's really also important to be able to determine who pays and also understand the relationships along the value chain because they impact who pays. And just a quick example, you can design a product, has great impact for the patient, but it will be used by a clinician and it will be paid for by the hospital. So you need to think about all of those things together and the interplay between those different actors in the health value chain. Thank you.
For my fellow innovators, especially us who are starting up, okay, let us take this space, let us learn. And then now for our fellow collaborators, I think mine is we should build inventor assistance program. Thank you.
Thank you. Thanks to our panel. DJ, is my song ready? Buka by Oscar Mbo. Okay, no problem. So this song is a gift from my country to everybody here. Its literal meaning translates to get up, there's work to be done. But I think in the context of NCDs, it is especially fitting, and especially to think about movement and how we navigate through the world. And just to keep the conversations going over lunch, I think it doesn't stop here. Keep connecting, keep collaborating, and let's make a dent where it matters most.
Okay.